Without a voice, we cannot be heard. And without a true voice, we cannot be known. With a true voice, together we can bring in healing, love, and peace to this world that desperately is looking for those things. We might, and I say we can, even end all wars, inward and outward. And if that's what we want, if what we really want is our voice to be heard, then why is it so difficult to speak? What is in the way? Well, certainly fear is an important piece here. Afraid that you'll be canceled, afraid that you'll be misunderstood, afraid that you'll be thrown off the island, ostracized, censored. Who knows, even worse. If you were to learn now, like right this minute, that today was the last day that you were going to be here on the planet, I ask you, what would you do with the rest of the day? Now, when you think about that, more than likely, if you're like me, and like most people, you would go find someone to tell a truth to. You'd be like, oh, I'm going to go tell my wife I love her. Or I'm going to tell my children that I love them. Or I'm going to tell my friend that I stole $5 from them 25 years ago. But one thing I'm going to do is tell the truth. You see, we know that the truth matters. And when backed up against the wall, we also know where we are not telling the truth.
This is The Healthy Healer, where true voice is your medicine. This is where we help doctors and other healers navigate through the challenging times by learning from the best minds in the healing industry. Laugh, cry, and be surprised. It's entertainment, education, and inspiration so you can continue to be the unique and amazing healer you were destined to be. Welcome to humanity. Welcome to The Healthy Healer with Dr. Fred.
Hello, and this is Dr. Fred, and I just want to let you know how really honored and pleased and really privileged I am to speak to my upcoming webinar. The webinar is all based on the passion in my life, which is helping people really find access to their truest voice, their core values, their innermost self, the part of them that have been often hidden or stifled or smothered or silenced or in some ways unexpressed. This has been a passion of mine for the last 5 years, as some of you already know. And that's why I wrote the book called Find Your True Voice, and also why I created the course called the True Voice Course. Over time, this has developed a little further. And now who I am is someone who has developed the Healing the Healer course. And the Healing the Healer course is based on a very similar technology and a very similar methodology, but it's aimed at my friends, the healers. As most of you know, I've been a doctor for many decades. Well, I've been in the mental health field for 43 years, and I've been an actual physician for over 30 years, closer to 33 years at this point. And I've really been committed to bringing my very best foot forward and helping people get better. One way or another, my commitment has been to optimize people's lives. And as a psychiatrist, that's been the job title that I thought that I was carrying on. Now, it turns out that that job got squeezed out a little bit over time. And the way that that got squeezed out was it became more of a job based on this whole notion of biological imbalances and the need to treat people with medications as a way of managing their mental health. All of this was borne out while I was in training in 1987 with the advent and then introduction of Prozac to the world. And Prozac had an impact on the world that was so large that most of us have forgotten it, or many of us weren't even born to see it. But the impact was so large because prior to that, it was thought that psychiatry was a field of communication. And that's why you might remember there were times when psychiatrist was associated with being on a couch, which actually having discussions and communicating and then connecting with each other was thought to be the healing mechanism best suited for helping people get better. This is how I grew up. I knew that under all conditions, human conversation and human connection was at the source of all healing. This is all, communication at the source of all healing was a requirement. And without communication, that wouldn't take place. Well, over time, psychiatry bought into this whole notion that there was such thing as a chemical imbalance. And if people were unsteady or didn't feel balanced or in any way uncomfortable with life, that was thought to be a disorder inside of the person rather than a proper response to the world going on around them. Of course, this is a twist of truth, and there are certainly times in space where being uncomfortable with the world around us is what's called for and doesn't make anyone sick. So the whole idea of mental illness being a conversation subject to, subject directly to a transformation was something that I hung on to over the years. And I attempted my best to stay within that during my time as a psychiatrist. So over time, what ended up happening is that this became more difficult and more difficult as psychiatry became typecast as the field to send somebody when communication didn't work. And people, and even my colleagues and the referral sources did not expect me to use communication as the source of my healing, because they had felt that they had already tried that talk therapy or communication method. And they expected me to actually bombard people with medications as a way of dealing with their concerns or their illnesses or their troubles or their sense of dismay. Now, we should know that that's not the way that really healing takes place. And in the last several years, I've altered my practice so that who I am now is the person who really just emphasizes the importance of being authentic with oneself, being really true to one's values, being instantly accessible to one's core self, and then bringing that forward so that the person that you or people that you're with or that you're communicating with are dealing with an honest version of yourself, a core person, a core version of yourself. And that's what we decided. That's what then came through for the next couple brands. Welcome to Humanity is self-explanatory and is the brand that I created several years ago aimed at that. And then came the True Voice course. The True Voice course is built on the heels of the Find Your True Voice book, which I'm very proud of. And this book shows you how to really easily and with a time-proven methodology find your core self, because you can't be wealthy doing something that you just dislike. Let me say that again. You can't be wealthy doing something you dislike. Many of us have found ourselves now doing lots of things that we dislike and attempting to be wealthy, maybe by bank book numbers or some other way. But in fact, being wealthy and doing something you dislike are not compatible with each other. In order to be wealthy, you need to be living life in a way that is consistent with who you really are. And that's what this course is about. So the webinars that are being created are aimed at people who are very interested in being wealthy and actually having a life that works, and doing so by actually finding and rediscovering their true self. This particular webinar is the 5 ways to rediscover your true voice. And it's associated with the 5 methods that are noted inside of both of the courses that are associated with it. And that includes Healing the Healer, as well as Find Your True Voice. So that's what I've done. Is this webinar is a place where we get to meet, you get to meet with me, and we get to discuss the really not so long pathway between where you are now and then coming to grips with who you really are, and then delivering that person who you really are to the world that is eagerly waiting to receive it, and then living a life actually consistent with that person who you really are. So that's the point of this course, and that's the point of the webinar. I am super excited to be delivering this webinar to you, and it's my opportunity to really step into my true self. Is something that I've been able to do over the last several years, is to become much more authentic with who I really am. And as a result, I've become a healer even more so than a doctor. I invite you to join us in this upcoming webinar, the 5 ways to rediscover your true voice. And we'll go over ways that you might never have thought of to come in touch with that person who otherwise has been muted and muffled and stifled over the last several months and years. This course has been generally aimed at healers, meaning people who would label themselves as healers one way or another. That may and probably does include you, because after all, we're all healers. But if you're an alternative healer or a nurse or a social worker or a counselor of some sort, or a Reiki worker, or an acupuncturist, or in some way an alternative healer, along with being either a doctor or a nurse or a psychologist, this course is for you. It's a great space to find yourself and find your true voice, and then heal the healer within you, so that you can go back to actually having the job that you thought you were taking when you started this profession many years ago. It's an honor to bring you this webinar. I'm hoping that you enjoy it and that we'll see you at the next episode of it. I'll be there in person and be available for any questions. And we have several special gifts to offer you as well when you sign up to be in this course. Several other ways that really work to support and then buttress up everything it takes for you to get in touch with that true self of yours and bring that piece forward. Times are difficult and challenging, and many of us have found a reason to stay quiet when we know we had more to say. And many of us have found reasons to say things that even we disagree with. This, of course, is unacceptable in a short life. And so our goal is to help you stop doing that, rediscover your true voice, come to grips with it, and then deliver it effectively into the world, a world that is eagerly ready and to receive it. So thank you very much. And I look forward to seeing you at the next webinar. I'll be there in person. I hope to see you there with bells on. It's time to get your life moving forward. Time to heal the healer within you. It's time to actually bring forth your true voice. Thank you very much, and we'll see you at the webinar. Bye for now. Hi, everybody, and welcome to The Healthy Healer. I'm Dr. Fred, and I'm the host of this program, and it's just an honor and pleasure to be here with you this morning. On a weekly basis, I like to bring you doctors and other healthcare workers who have gone through a lot, who've already had a life in the field, and who have much to say about how they got to be who they got to be, as well as who they are for others who are having some difficulty or maybe even already aligned with who they are in the healthcare field. It takes something to be a healthcare worker. It's a lot different than what you thought it was when you came into the field. And the Healthy Healer is really built for those people who are either just coming into the field and want to prevent this notion of burnout, or who are far into the field and realize that they're no longer resonating with the job that they presently have. These people, you who are listening here, who really are looking for what is it like to be a healthy healer, are the point of the show is to be compelled by the guests and the conversation, such that you can realize that you too can fall back onto the track of being compelling and being inspired by the job that you're doing right now. You went into this work actually hoping to be a certain kind of player, a certain kind of healer. And likely by now, your job has shifted drastically. So you're no longer perhaps playing the same game you once played. The idea with the Healthy Healer is realizing that in order to heal someone, you need to create an honest to goodness human connection. And the only way you can connect with someone really honest to goodness, is by being aligned with your true self. If you're not aligned with your true self, you can't really connect. Who's connecting with that other person is someone who isn't you. The idea is to be resonating harmonically with yourself so that you can be the healer that you were born to be, so that you can be the healer that you aspired to be, that you can be the healer that you were educated to be. Today, we have a guest that's really taking us into a new level of what that means to be a healer. Who she's become over time is someone who has built on her past a level of passion, a level of concern, a level of commitment in an area that maybe she didn't even know that she was going to be involved in not so many years ago. I'd like to introduce to you Dr. Sadaf Lodi. Am I saying it Lodi? Is that right?
Lodi.
Yeah, Dr. Sadaf Lodi today. Thank you so much for being with us. It's a deep pleasure. Thank you for being on The Healthy Healer. Welcome.
Thank you so much. I really appreciate your time and everything you're doing for your listeners. And it really is an honor for me to be on your podcast.
Thank you so much. It's really great to have you. In my podcast history, one of the things that I find is as a host that can be really helpful for the listeners and really helpful for both me and you is a difficult question that only has 9 letters in the entire question. It's probably the shortest question of all time. And it's one of these questions that, when answered, really, really opens up the gates and the doors for those who are listening to get a better handle on what are we up to. So that question, if you don't mind, I'd like to pose to you right now. That question is the 9 letter magical question of who are you? So who are you, Dr. Sadaf? Who is it that we're having a conversation with this morning?
Yeah, so thank you. My name is Sadaf Lodi, and I am a board certified OBGYN. I'm currently practicing in New York. I am the product of immigrant parents that came over from Pakistan back in 1974. And so I was actually raised in Michigan and then grew up there, went to medical school there, and then now I'm practicing in New York. I have been practicing OBGYN and still currently do. It's been outside of residency about 19 years now. And but most recently, I started to focus on sexual health and wellness and menopausal health. And the reason why I did that is because I found that there was just a paucity in people actually practicing and dealing with sexual health. As you know, being a medical provider, that in medical school, we don't really get much education regarding sexual health. And what little education we do get is surrounded and based on research that was conducted in the 1960s, and really has changed much since then. And now the literature and the research focuses a little bit more on women. Before it didn't. Before, it was in 1966, what the model that we had was Masters and Johnson, and that was research that was based on white individuals, white men. And now, so there's more research on women. And in 2001, there was somebody by the name of Rosemary Basson that came up with the female sexual response cycle. So um, in the real reason why I do it, why I do what I do, focusing on sexual health and menopausal health, is to empower women and to educate them about their bodies and their health.
Good. Okay. So thank you very much. That really gives us an idea of who you are. Now I have another question, which is, as you were growing up, did you know that you were headed in this direction, or when did it become clear that, focusing on women specifically, and then women's health, and then women, educating women about their body, their functioning body as a, menopause and sexual health are both, in some ways so uniquely well, let's put it this way: they're different from women than what they are for any kind of version that might exist for men. So there's a uniqueness in helping women get in touch with their own unique woman or feminine self. When did you know that you were headed in that direction, or that you had a superb skill to provide those kinds of services?
Yeah. So definitely when I was growing up, I never really saw a role model that I could see myself in. I didn't know very many gynecologists. I knew of one. And when I had mentioned to her, after I had gotten into medical school, after I had mentioned to her that I wanted to do OBGYN, she actually told me not to.
Right.
She said it was, it's very intense, and
It is.
that you are never, that you're never really home with your family. And she actually told me to do anything but that. But, as you know, when you find a specialty that you really like, and that you really see yourself doing, you just kind of go after it. And I was pretty driven, and I really enjoyed surgery and medicine, and, OB combines too. And plus, I really enjoyed the just the rush that you got when you delivered a baby. And so that was why I went into female medicine. And also because I really felt that in the way that where I grew up and things like that, I felt like women, um, there wasn't that much attention put on women and or women's health, and especially not being able to find any role models that I could see myself in, or even in their place. I just felt like that was something that I wanted to highlight. I wanted to be the role model that I never had, and that's really
Interesting.
why I went into it. Yeah.
You wanted to be the role model that you never had. That's really great. Yeah,
Yeah.
and by the way, my first rotation in my third year was OB-GYN, and it was extremely difficult. It was 1986, and the trying nature of simply the medical school rotation itself was extraordinary. I remember it was something that about 1986 because um, I was in Chicago at the time as a medical student, and the women that I was taking care of, there was a really significant there was a really significant World Series going on. The baseball World Series was going on about that time during my rotation, and people were naming their babies after some of the players.
Oh yeah.
So that was like there was like a little epidemic of each baby getting a player's name,
Oh, that's
and
so funny.
it was kind of interesting. And the difference between there's a big difference between OB and gynecology. And tell us a little bit about what you've noticed there and where any of your passions might lie differently in OB than in the gynecological field.
Yeah, absolutely. So, as you know, and I'm sure most of your listeners know, obstetric OB stands for obstetrics, and obstetrics is mainly taking care of women in their pregnancy, right? So it's really during those fertility years and managing their whole pregnancy throughout all the different trimesters. Of course, the one trimester that we never focus on, which is the fourth trimester, which is when women deliver and postpartum, and that's also an area that really needs more research and more support. And that's, when women deliver, a lot of them will suffer postpartum blues, and some may even have postpartum depression and postpartum psychosis. And we know that one of the biggest risk factors to having a baby or a pregnancy is actually maternal suicide. So that is one of the main causes of maternal mortality is maternal suicide,
Hmm.
and after that comes maternal hemorrhage. So it's really important that we discuss mental health, when women are pregnant and once they deliver. So obstetrics is great, and it's great for delivering and taking care of women during that time. But gynecology for me was more even in residency, right? So we didn't really learn anything about sexual health in residency. We didn't learn anything about menopause. We didn't learn anything about postpartum depression. We just don't learn about these topics, even in a residency. And most recently, I was working at an academic institution, and even in that place, the residents didn't learn anything about sexual health. So it's really important that we are teaching our future doctors, but just it seems like nobody really is. Um, when it comes to gynecology, we talk mostly about like preventing disease and sexually transmitted infections, and about the different cancers and things like that. But again, we just don't discuss sexual health. We don't talk about it. There was most recently there was an article in the New York Times, I think it was back in November, that mentioned about the clitoris and how half the world has it, but nobody knows about it. Nobody talks about it, and just the whole function of it and the functionality and the purpose behind it. And then, of course, there was another article most recently, I think about 2 weeks ago, in the New York Times, talking about menopause. And now Oprah is talking about menopause, and everybody's starting to talk about it. Michelle Obama was talking about menopause. So, these are topics that we don't encounter very often. I don't know if it's just that there's a lot of taboo. I think our media and everybody's really focused on the youth and young people, and I think that's really important. But I think that there's an area where we could definitely devote more attention to and more research to, and that is, as women age, what are the things that they need, and how can we help them? How can we better serve them?
Yeah, beautiful. So I hear what you're saying. I have a question for you. Part of the theme of the healthy healer is this idea that communication, conversation, creativity, and specifically human connection are at the heart of all healing. Are you finding that as a woman yourself and someone who's maybe more aware, probably, clearly more aware of some of the intricacies of sexual health or intricacies of the effects, one way or another, of menopause or of regular hormonal changes of a woman, that in your connection with your patients or your clients, that there is a surge of healing that takes place inside of that connection, even more so than the information that you provide for these people?
100%, absolutely. So, I think that first and foremost, because I'm able to relate to the experiences that a woman has during this time, I think that they feel more comfortable talking about those changes. As you probably remember from med school, women go through hot flashes, night sweats, mood swings. They can have palpitations, they can have brain fog, all of those things, right? And so there's so much to it, and we just never talk about it. So definitely, women feel more comfortable talking to other women that may be experiencing the same things. And also, when it comes to sexual health, specifically during menopause, you have, and perimenopause, you can have vaginal dryness, you can have pain with intercourse, you have decreased libido, you have decreased arousal, all of those things. And so, when you actually find a provider that feels comfortable talking to you and conversing, then it's almost like they're in your head, right? Like they know what you're going through and they can talk about it and then articulate ways for you to move forward and move, perhaps get the help that you need or the medications that you need. Or maybe it's mindset, right? Maybe you need to talk about, the negative beliefs that perhaps you were raised with and how you move past that. Or maybe there's some body image issues, maybe there's sexual trauma, all of those things. So, yeah, I think that women tend to feel comfortable with me specifically just because I'm able to relate to them and to open up that communication that often when they ask their providers, even their providers don't feel comfortable talking about because we just don't learn about it.
Right, exactly. So I guess one question that comes up is it even possible to be an attuned male OB-GYN provider?
That's a great question. And, I don't want to answer for all the other 50%. I think that you can be. I think that there's a lot of men that perhaps can empathize with what a woman goes through, but I don't think you truly know, right? And I know that I've spoken to women in the past that feel that their providers have been very dismissive about their symptoms, and specifically during menopause, right? They'll say to them, "Oh, it's all in your head." In fact, there was a recent article, I don't know if it was in the New York Times or the Atlantic, but I know the author, and she posted on her Instagram saying how she was dismissed by her gynecologist who told her that it was all in her head and that, her decreased libido, she needed to just go and find another partner and that, there was nothing wrong with her. I think that when we as providers become like that to our patients, then it really puts the medical profession under, I don't know. I mean, I just want to say that people just don't like going to physicians then, right? They don't appreciate their physicians being very dismissive of their symptoms and they want to go to somebody that can empathize and relate and talk to them about their symptoms and then give them solutions. Nobody wants to hear that whatever symptoms they're experiencing is all in their head and it'll be fine if they just get a new partner, right? That's not what you want to hear. When you go to a doctor, you're hoping to find some solutions. You're trying to figure out what's going on with your body and what's happening, and that you want to know that you're not broken. There's not something wrong with you.
Absolutely, yes. And so you're speaking a little bit to this notion of the interface between mental health and OB-GYN. And it was frequent enough in a few of the hospitals that I worked in. I worked in several hospitals when I finally did get released as a resident, and then began to be an attending in Cincinnati. Um, that the consult conduit between OB-GYN and psychiatry was pretty strong for some doctors. There were some obstetricians and gynecologists who really felt that they could receive help, appropriate help from mental health providers. And I would be frequently in the consult liaison rotation that I was in at these hospitals. I could be frequently consulted by that particular subspecialty. Um, you had mentioned earlier that, this in the fourth trimester, there's sometimes things that can happen in the postpartum blues or the postpartum psychosis. what is it that you find you can do to really, this is kind of a loaded question because I'm no longer the same doctor I was back then, by the way. And but what is it that you can find that either psychiatry can do or mental health can do or you can do to help your clients in that fourth trimester when they're going through those psychological discomforts or psychological pains or traumas or miseries, or yeah, that might be along go along with being in the fourth trimester of a delivery.
I think you mentioned it before, and I think one of the most important things we can do is communicate, right? Communicate with our patients more than just at the 6 week visit. I think now what I've noticed is that there is a trend to see patients a little bit more frequently, even postpartum. I know that one of the clinics that I work at, they see patients, 1 week after, and then 2 weeks after, and then 6 weeks after. But I think that having that constant communication with the patient is really, really important because so many women suffer through anxiety and depression and blues after they give birth. And a lot of times they don't have that family support to help them navigate those emotions and those feelings. And so then, it behooves the provider to follow up on that patient. The problem that we have with our system is that, we are asked to see patients every 15 minutes. So it's hard to spend that time with that patient that may be suffering from a little bit of anxiety or depression or adjustment disorder after they have the baby, and to really figure out what's going on with them and how they're feeling. One thing that does help us as OBGYNs is the Edinburgh depression scale that we do postpartum, and also the PHQ-9, both of which help to figure out whether or not a patient is experiencing depression. Something that ACOG has recently, and I think it's been a few years now, but they've advocated for OBGYNs actually doing that depression scale in every trimester and definitely postpartum to help figure out whether or not a patient is experiencing anxiety or depression and whether or not they need additional support and help via a psychologist or a psychiatrist or somebody, or even meds during the pregnancy. And so I think that is really, really important to help patients navigate their feelings and their emotions during the pregnancy and even postpartum.
Excuse me. Um, so when someone is a gynecologist or when someone's in your field, if it does come to fruition that that doing the work is a little bit too arduous, is a little bit too demanding, and in fact, there are certain situations, of course, where your field is so demanding that it does stretch the actual clinician to find their own sense of mental health disturbance, their own sense of mental health imbalance or mental health discomfort. What do you say to other, maybe younger or even older people in your field, either as the doctor or the nurses or even midwives or anyone else who's actually managing inside of um, the female sexual health or in fact even the menopausal health, who are running into the situation where they're no longer passionate with the job that they're doing. They're finding themselves out of line or out of tune with what they thought they were getting into. Do you know people like that? Number one, is that a possibility? Does that sometimes occur? And number two, what would you say to those people at this time in order that they can refine their own inspiration to continue doing what they came here to do as a healer?
Absolutely. Yes. So, I've definitely experienced burnout myself. I think that OB is a very intense specialty. And, in the beginning, when you're doing it, it sounds all very exciting. And, oh, you're running to this, you're running to that, you're running to a delivery, you're doing cases, you're doing surgeries, there's a stat C section, all that stuff, right? The adrenaline's going. But, after 20 years of that, you're pretty much done. So yes, you have to absolutely find something that you feel passionate about, that you feel that you can almost reinvent yourself, right? Whether it's in the confines of your specialty or outside of your specialty. I found that for me, something that I felt was not discussed very often in not only just society, but even in our obstetric circles was sexual health. And so that was something that I became very passionate about, and also menopausal health, right? These are definitely two areas of gynecology that we just don't focus and we don't learn much about. And so for me, it was finding something else that would ignite my passion and that I would really enjoy learning more about. And so for anyone suffering through burnout, I would say that, try to find something that you feel really passionate about and to know what your why is. My why is to empower and educate women about their own sexual health so that they can have agency over their reproduction and their reproductive um, life. And that's why I do what I do. So I think that finding your own why, realizing what it is that you feel passionate about, and then going for that, whether it requires additional training, additional education, but finding that passion that then can reignite your love for medicine is what's really important.
Yeah, finding that passion. So in some ways, it might really require an about face, or really stopping and relooking again at why did you go into the field in the first place, or what's really here for you now, what's missing out of your life that you're no longer able to bring your deepest core self into the workplace, right? Like what,
Absolutely.
like, and are you finding that there is any kind of trends either towards burnout or away from burnout in the recent years? And I guess I'm not speaking directly only to COVID, but in recent changes in the medical field and how the medical field is seen by the rest of the world. Yeah, I wonder if there's been any increase towards a sense of feeling misaligned, or no longer resonating with their, or no longer inspired with the job.
I think that is absolutely a trend. I'm in different Facebook groups, and there are so many physicians actually looking to get out of medicine, right? And I think it has a lot to do with the fact that, private practices are being bought out by large corporations. People feel like they're just a cog in this wheel and they're just spinning, and that they really are not getting paid what they're worth. I know that some healthcare providers get paid more because the need is more in a certain area and things like that, and others are not getting paid very much. And I think that when you work in a specialty such as OB, and the amount of malpractice that's charged, and the amount of risk that you take as a provider, and then to not get compensated what you feel is your worth, really adds to that burnout. And definitely, it is an increasing trend. So many OBGYNs are trying to get out of just delivering obstetrics because it's to them, it's just not worth it. The risk is not worth how much they get paid. And I think that, lots of physicians are trying to reinvent who they are, and also trying to come up with different streams of income such that, if they are experiencing burnout, or if they get fired, or, something happens, they experience a disability that they're not able to practice medicine the way that they want to, that they're not going to be left high and dry, that they can provide
Mhm.
for themselves and their family.
Right. So there's a real, that's part of what my passion is, and part of the point of this particular podcast, as well as the course that I developed called Healing the Healer, which is really taking a look at our fellow brethren and sisters as well, who have come into the field on a particular passion. Pretty sure that they were blessed with a gift. Pretty sure that they had something that they could provide for the rest of the world. And then the job comes in the job description, as well as the actual boots on the ground of what it means to come to work every single day. And it kind of takes away and maybe sucks some of the energy out of that slowly but surely, or sometimes abruptly, and leaves people feeling um, incongruent to who they are, or who they wish they were. And I'm looking really to help those people. What would you say to some people in OB/GYN who are starting to feel that?
I would tell them that there is hope, right? A lot of times people feel hopeless. They feel that even though they don't want to keep doing what they're doing, they have no other choice. This is the only way they can make money. And I would really ask them to be curious. I would ask them to look at things that really excite them, that, reignite the passion that they once had for medicine. But it doesn't have to be medicine. It could be coaching, it could be something else, right? And then you can use your skills. And that definitely physicians are very intelligent. And it can be other providers as well, but I'm just referring to OBGYNs. So, it's important for us to realize our worth, know that we are very intelligent people that are driven, and that we're able to accomplish goals that we set for ourselves, right? We went through med school, that wasn't easy. We were able to go through residency, that wasn't easy. And then we were able to practice if we decided to practice, and to just know that we are capable of so much, and that what we do doesn't define us, and we get to decide how we want to define ourselves.
That's beautiful. So there's like an expansion of our resourcefulness, the idea that we are resourceful, of course, as shown by our recent history and who we were in order to get to where we wanted to get to. We had to show a whole lot of resources. And then to get through all the hurdles that it became that were there for us in order to get to where we are now, it took a fair amount of resourcefulness. And we tend to forget that. We as physicians tend to forget that we have all sorts of room to do things that we're more passionate about than what we're doing right now, or
Ab-
to do what we're doing right now with a greater sense of passion.
Absolutely,
Yeah.
100%. Yes.
Yeah. Beautiful. Okay. And so when we start looking at the interface between like the women who are OB-GYNs, or women who are, obstetrician and gynecologist, I just say, and then women who are in other fields as well. So we're looking more maybe like to family practice, or we look to the broader picture of general practitioners, et cetera. What is the difference, do you think, between the pressures of a obstetrician gynecologist and the pressures of being a woman in medicine in general?
Yeah, I think that, women in general, I know there's been several studies that have come out and that have noted that there is definitely a gap in pay, right? That men tend to be paid, even in specialties where now before, there used to be more men in OBGYN. Definitely when I was a resident, there were more men in obstetrics and gynecology. And then as I went through residency, and now I would say the trend is more that there are more women in OBGYN. And there's been definite research that has shown that whatever specialty women tend to dominate, that specialty ends up making less. So we make less money, even though we're doing the same amount of work, right? And we are still taking on the same amount of risk, the same amount of stress, all of that. And I think, especially for women, women tend to have an uneven distribution of chores, even when it comes to home. Women can come home and they, are, even if they're working outside of the house, they come home and they're, in charge of taking care of the kids. And then they're the laundry, the food, the meal prep, all that stuff, right? And when we talk about the uneven distribution of chores, that also plays into effect of how we feel about sexuality. When we are always focused on other things, then relationships, intimacy, that just becomes another chore. And so then women don't want it. And especially if they are not getting anything in return, right? If there's nothing in it for them, if they don't experience pleasure in their relationships, they're not going to want it. So I think that definitely stress starts to impact every aspect of our lives. And when you are in a very demanding career, such as obstetrics and gynecology, it starts to spill over into other aspects of our life, right? We're not able to, our sleep patterns are all disrupted. Our circadian rhythm is off. Our cortisol is on hyperdrive. We have adrenal fatigue. We, are not able to function properly. And they say that people that are sleep deprived, it's as if they are drunk, right? When they're driving, it's as if they're drunk. So all those things play into effect. And I think that really messes with our mental health. And so I think it's very important for women specifically, and women that are in very driven, high pressure careers, to take a look at their lives and see if they're really happy with what they're doing. And if they're not, then to find ways to bring that happiness back. I think that there's definitely other specialties in medicine that are perhaps a little bit more conducive to, say, like a family life, to being able to spend more time with their family, with their spouse, with their partner, even just to have more time alone and away from medicine, right? That gives them that space. But when you're in a very driven and high pressure field, you don't always have that luxury. So I think that it's just important to figure out, why you're doing what you're doing, and if you're really happy doing it, and if it brings you joy.
That's right. It makes a lot of sense. Thank you. So, um, for other women who are like noticing that they're feeling burnt out in their field, if like, this idea you had mentioned that it kind of leaks into the sexual health, that they are burnt out with their everyday chores, with everything they have to do at home and everything they have to do in their occupation, or everything that they're doing, to get the kids from here to there, or to take care of food, take care of laundry, take care of chores, take care of their husband, take care of everything. And then there's not a whole lot in it for them. what are some simple practices that you can offer to these women so that they can find satisfaction in their day-to-day life immediately?
Yeah, absolutely. So, some of the things that I say is to find ways to create intimacy in your relationship that doesn't require really anything, right? Except for just being present. So, one of the ways that, and multiple research has shown this, that just being mindful in your day to day life. And I know that's a real buzzword, and I know it's like a hashtag and all this stuff, but really, it's truly been shown in research that if we are mindful in our relationships, if and as you're a psychiatrist, and I'm sure most of your listeners know that being mindful is just being present in whatever situation you're in without judgment and with compassion. And so if we are able to be mindful in our relationships, then that actually increases arousal and desire in our relationship. Also, ways to increase intimacy in a relationship, you can have intellectual intimacy where it's you're communicating your likes, your wants, your desires, you're connecting through exchange of ideas or discussion. You can also have physical intimacy, right, which we know it can just be even holding hands, it can be cuddling, it can be eye contact, it can be touch. It doesn't always have to be like a sensual type of touch, it can just be a hug, right? And that can create that intimacy in a relationship. It can be an emotional relationship where we're able to trust the other individual through honesty and share our innermost thoughts and feelings. Um, some ways that women can increase that intimacy, like I said, was practicing mindfulness. They can also start by accepting and loving themselves as they are now, right? Just not waiting for that perfect body or for that perfect job or for that perfect time, but just loving yourself now, I think, is really important. Because when we're able to love ourselves, then we are then able to share that love with others, and I think that's really important. Also, realizing that love and intimacy is going to look different as we go through different ages in our life, right? That we may think that, perhaps in our 20s, our love was more spontaneous, intimacy was more spontaneous. But if we really think about it, we actually planned those events, right? So when we went on a date with somebody, we planned out what we were going to wear, where we were going to go, what time, we were going to be there, what it was going to look like, and how that night was going to end, right? So we actually planned those things. And so I would ask this person to also go ahead and plan date nights with your spouse or with your partner or whoever, and so that you have something to look forward to, right? So a lot of times intimacy gets placed on the wayside and we just don't make time for it because of all of the other competing things in our brain and in our life. But if we set aside time, then we will make time for that. And then that will only build our relationship and build that intimacy with our partner and our loved one. And I would also ask that, you continue to write down what you want and communicate what you want, because we know that in several studies, it's shown that the biggest factor in female satisfaction, sexual satisfaction specifically, is that there was communication in that relationship, right? Just the ability to be able to have that conversation. And if you find that that conversation is difficult to have with your partner, then maybe again, write it down in your phone, right? And so that you get notified that, at 9 o'clock, when we're both done with whatever it is that we needed to get done, we have that half hour or even 15 minutes, right? Even if it starts with like 10, 15 minutes to sit down and just be present with that other person and to talk to them and ask them, how their day was and what they like, what they want, what they desire, and make it fun and make it playful, but also keeping that communication open so that you can understand what your wants are and what your partner's wants are.
That's really great. It points a lot to what we're talking about, this idea of communication being at the heart of all healing. I think what you're really saying, and maybe I can, extrapolate this,
Yeah.
is that communication is at the heart of all intimacy, and intimacy at some level is at the heart of all healing in relationships. So maybe that's what we're
Mhm.
saying. Yeah.
Absolutely.
And
Beautifully
that's what
put.
we're really after put. That's what we're really after as humans, actually, is that level of intimacy being at the heart of our own healing.
Absolutely. I love it. Yep.
Yeah.
That's
Thank
exactly
you.
it. Yeah.
Yeah, so that's great. So, where can people find you if they're interested in continuing working with you, or they want to learn more from you, or they want to learn more about you, or maybe they want to become a colleague or a patient or a client, or they have a question for you? Where would people find you on the
Sure.
internet?
Yes, absolutely. So I am all over social media. I am on Instagram and TikTok at Dr. Sadaf. That's DRSADAF, OBGYN. And that's on Instagram and TikTok. On YouTube, I am at Dr. Sadaf Intimacy Coach. And I have a website called drsadaf.com. And I have, I feel like I'm all over the place. I have a podcast as well called the Muslim Sex Podcast. And you can definitely email me at drsadaf@drsadaf.com. So lots of ways to get in touch with me. You can definitely DM me on Instagram and I'll be sure to respond. So
That's super
yeah,
great. Yeah,
I'd love to
I'm
hear from
sure
you.
that you're very reliable about your response. It's important to you to stay connected to the people in your world, and I truly appreciate that. I
Absolutely.
also appreciate the conversation that we've had today. Is there any kind of questions you would like to either ask me or any sort of closing thoughts that you'd like to bring into this conversation before we actually do taper this down?
Thanks. I think that, what I would say, and I think that actually you put it beautifully, is just that, communication is probably the most important thing in any relationship, regardless of what type of relationship it is. And that it's so important to be able to have open and honest discussions with your partner to create that emotional intimacy, which then eventually leads to physical intimacy. But it's really that communication which is the basis for everything. So I think that that's
Beautiful.
what I'd like to leave with. Yeah.
I love that. That's great. And we're in full agreement there, and I totally appreciate it. Dr. Sadaf, it's been a deep pleasure having you as a guest on the Healthy Healer. I look forward to playing around and working around with you and maybe even sharing some clients or some ideas in future consultations. I also look forward to future conversations in the podcasting universe and to following you and seeing what you're up to as you take on the cutting edge of what it means to be a communicating obstetrician and gynecologist. Thank you so much for being you.
Thank you. And thank you so much for your time. And thank you for the opportunity to be here with your guests. Thank you so much.
Welcome. Thank you again. And this is Dr. Fred signing off. Welcome to another episode of the Healthy Healer, and we will catch you on the flip side. Dr. Sedef is here today, and we really have had a masterful conversation. I hope you enjoyed it. Bye for now. Hi, it's Dr. Fred. And after Dr. Sadef's podcast today, I decided I would leave a little short here to talk a little bit about some of the things that she had talked about in her program. One of the things she mentioned was the fourth trimester. Now, a trimester suggests that there's only 3 trimesters, but the fourth trimester is a buzz term for the first trimester or the first 3 months after the child is born. She mentioned that a leading cause of morbidity and mortality is self harm or even suicide of the mothers who have born babies in the previous months, and that this is a significant problem inside of obstetrics and gynecology. This is a significant problem for a lot of people. This idea that there's depression and anxiety that can arise after a major life event. Certainly, having a child is a major life event, and there are hormonal implications as well. So, I'd like to speak to the idea of postpartum blues or postpartum depression or postpartum psychosis, which Dr. Sada brought forth in her conversation. In my way of thinking, it doesn't appear that medicines are the best way to go in that setting, although clearly some people have found relief when they've used medicine in that setting. The medicines, the antidepressants such as SSRIs, even if they're physiologically determined to be safe at that time, don't seem to provide what is necessary in order for a woman or anyone to feel whole upon taking those medicines. Although it can relieve the pain, it's sort of like what it takes to um, deal with a mosquito bite by amputating the limb that has the mosquito bite on it. For instance, if you had a mosquito bite on your elbow and I'd let you know that I could cure that mosquito bite by cutting off your arm, we could be certain that when you came back to see me a couple weeks later, you would no longer have the mosquito bite. And if you stayed myopic enough long for this process, you may even consider that a cure to the mosquito bite. However, the losses that take place with that amputation are obvious and extreme. That is my experience with using antidepressants in fourth trimester mothers, as well as anyone really in most cases of acute depression. The idea being that you, in fact, might get a remediation of the depression, but the truth is that you also get a loss of so much more of your emotional and psychological functioning as a result. So you kind of just blunt this stuff down with these medicines, and it causes more symptoms in many cases than what were there in the beginning. The idea is that these medicines often perpetuate or cause or certainly increase the symptoms that's marketed to treat. And that possibility is too high a price to pay in my world to actually medicate these mothers or medicate anyone who is in acute depression. Instead, what I'd like to bring forth is the best way to manage any kind of psychological or emotional distress is to communicate, as Dr. Sadaf also pointed out. The idea of communication, conversation, creativity, and specifically human connection as a source of all healing can't be underestimated. It can't be overestimated either. The idea here is that once you connect with somebody, once someone actually understands your experience, it's amazing what level of healing takes place, even on a physiological, apparently physical level, that doesn't necessarily equate to the psychological level that you might expect changes. So it isn't like it's all in your head. It's just that communication, connection, uh, and conversation are at the heart of all healing of all conditions of all type. And that includes in not only the physiological type or the physical type, but also the mental health type. A little more clear with the mental health type, this idea that connecting with another person can just not only feel very good, to have somebody kind of know what it's like to be in your shoes, as Dr. Sadaf did point to when she was speaking to a woman gynecologist's connection to her women patients. There's some special extra added attraction to getting someone having already experienced what they're experiencing. What I'm suggesting here is that discomfort, human discomfort, is ubiquitous and is universal, and that we all have an understanding of what that discomfort can be, whether that's through generational experiences or through personal experiences or through having lived our own experiences that resonate with the other person. Once we can connect with another person such that they realize that we get what their experience is, that's when the healing actually takes place and sometimes takes place instantaneously. I have a friend who used to work with pediatrics and would claim regularly that knee pain, foot pain, and even earaches would go away as long as they could connect with their pediatric patients and their parents. This is often the case in my experience as well, is that the pain and suffering from whatever conditions you have goes away almost instantly when you can share it with another person or have another person actually get you or resonate with you or harmonize with you or actually be aligned with what your experience is. So that's the part of the healthy healer that I'd like to put forth here. The way to be a healthy healer is to be aligned, not only with yourself, but with the people around you. If being a healthy healer means as a healer that you get to align with other folks as a way of healing them, what's most important is that you are in general healed yourself, meaning that you're aligned with yourself. And if you are misaligned with what you're doing with your life, who you're presenting to other people can't really resonate. It's like a tuning fork that's out of tune, won't be able to connect with the associated tuning fork that it otherwise harmonizes with. So, inside of healing the healer, the opportunity exists to refine your core values, refine what really matters to you, and bring that forth. The idea, again, is that if we're going to connect with other people as a source of healing, it's really critical that we're connected with ourselves and aligned and congruent with what we're doing with our lives, whether that's in our occupation or in our communication with our loved ones, our family, our friends, our bosses, our colleagues. It's very important that we stay in touch with being aligned with ourselves so that we know that what we're bringing forth is who we really are. It is impossible to actually be wealthy or to be a proper healer if, in fact, you're not aligned with yourself. Who you're bringing forth is no longer consistent with your soul, and therefore your soul won't be able to resonate with another soul, which I suppose is at the heart of the healing that I'm speaking of. Resonating harmonic souls is what's necessary in order to create the human connection and the unified intention that eventually leads to healing of all conditions of all types. Thank you very much for listening to this today. It's really important for me, for you to get that being a healed healer is what's required. So the healthy healer and healing the healer are both aimed at having you be healed to the point that you are resonating with yourself so that you can get again realign with the person that you went into the field to become. That person with all the gifts and blessings that was ready to deliver the healing aspect of yourself that may have become misaligned over time is now due to be realigned. Welcome to the healthy healer. Welcome to healing the healer. Welcome to Dr. Fred. I'm the undoctor, and it's my greatest opportunity and my greatest honor to share these gifts with you. Stay aligned, stay healing, stay a healer. It's a pleasure. Welcome to humanity. Bye for now.
So the questions I want to ask first is, do you want to get along better at work or maybe in the home? Would you like to get along better with your spouse or maybe have your children listen to you better? What it's going to take to do that is using your true voice. With a true voice, I contend that you can actually come across healing, peace, and love. And in fact, the only thing that's ever going to end a war is true voice.
Hi, this is Dr. Fred, and I am so excited to share with you my brand new podcast called Welcome to Humanity, where we explore together the human experience. This is the show that looks at what it means to be human and how to live an even more extraordinary life than the one we're already living. We do this through in-depth conversations with some of the most fascinating humans I have ever met on this planet. And as a psychiatrist and mental health worker, as well as a world citizen who's traveled the US and the world abroad, you can be sure I really have come across many fascinating people. Each guest provides a powerful case study, if you will, of what it means to live an extraordinary life. You walk away from these conversations enlightened and inspired and ready to make an impact in your world. The first 12 episodes will drop on Wednesday, May 20th, with new episodes releasing every Wednesday afterward. We call them Welcome to Humanity Wednesdays. On the very first episode, you'll meet Sarah Safari, a petite young woman who set an audacious goal to climb Mount Everest, despite the fact that she didn't even own a pair of hiking boots and had never even been camping. Just wait until you hear what Sarah faced when she found herself at the Khumbu Ice Falls, one of the most dangerous parts of the climb. It's truly a miracle that she's even here to tell us about it, and Everest is just the start of Sarah's remarkable journey. You can hear my entire conversation with Sarah Safari and 11 more incredible, binge-worthy interviews. It all starts on Wednesday, May 20th on the Welcome to Humanity podcast. Check out a sneak peek episode at welcometohumanity.net/podcast. Welcome to the show. Welcome to your life. Welcome to humanity.
This is the Welcome to Humanity podcast with thought leader and transformative psychiatrist, Dr. Fred Moss. This show focuses on the betterment of humanity on a global scale. Each episode will leave you enlightened, inspired, and ready to make an impact in your world. Welcome to the show. Welcome to your life. Welcome to humanity. Here's Dr. Fred.
Welcome to another broadcast of my podcast, the Welcome to Humanity podcast. This is Dr. Fred speaking, and it is another incredibly beautiful day on the planet. As I look out my window, I just see weather that is extraordinary. I see a calmness that's extraordinary, and nevertheless, we're living in some difficult times, and along with the difficulty, there's some beauty. And, you know, one thing about us is we continue to find a way to maybe be resilient or survive each and every day. And we continue to find a way to make a difference in each and every day and to have a reason to get up and live another moment. So I couldn't be happier today to introduce you to today's guest. Today's guest is Lawrence Gonzalez. And for those of you who don't know him, as soon as I say his name, let me tell you a little bit about who he is. First of all, Lawrence, welcome to the show. It's really fabulous.
Thank
to
you.
have you. You're welcome.
Thanks very much.
Absolutely. Before we dive in, I'm going to give you a little bit of what Lawrence has provided for us in the way of a bio and really in a way of getting an introduction to who this man really is or what he's up to in the world. But we're about to learn a lot more about that. Lawrence is an author of a lot of books, numerous books. He's won a number of awards, including 2 National Magazine Awards and the Distinguished Service Award from the Society of Professional Journalists. He received a journalism fellowship from Santa Fe Institute, and that was in 2015. And in 2016, he was given an appointment as a Miller Scholar there. Wow, this goes on, and really I see that there's just accolades after accolade. There was several things that happened, and then it looks like Lawrence wrote a book that eventually got a fair amount of notoriety. And this book is called Deep Survival: Who Lives, Who Dies, and Why. And then its sequel, Surviving Survival: The Art and Science of Resilience. This second book attempted to answer related questions as about how people make bad decisions and what leads some of them to survive and some of them to perish. And I guess it's more an extension from the first book because the first book also touched on that, as I recall. A new book called Flight 232, A Story of Disaster and Survival. And maybe he'll tell us a little bit about that. And wow, he's been a featured speaker, and he's got all sorts of things that I'm sure he's just itching to share with us. So before we dive into this amazing conversation we're about to have with Lawrence Gonzalez, I want to just take a moment and let you know that my book is put together, The Creative 8, and the audio release as well. This book teaches a really easy method for healing that utilizes creativity, connection, and self-expression. And as a listener to the Welcome to Humanity podcast, I want to give you a completely free copy of the audio book as a thank you for being a listener to the show. All you need to do is go to welcometohumanity.net/creative and download it. I've used this methodology with psychiatric patients, coaching clients, and even friends, and I get great results. The method takes less than 5 minutes a day to implement. I know you're going to love it. Go ahead and download it. Let me know what you think. Download your free copy of the Creative 8 audiobook today at welcometohumanity.net/creative. Now, let's get back to our conversation with Lawrence Gonzalez. So again, welcome to the Welcome to Humanity podcast, Lawrence Gonzalez. It's an honor to have you with me today. Thank you for showing up.
Well, thank you for having me, and I'm proud to be a human.
Say more about that, Lawrence. There is something about being prideful, about being human. I share that with you, and I share it specifically this morning. It's almost like you're reading my mind. Say what you're sort of referring to when you say proud to be a human, please.
Well, we have this extra layer of brain material. We have some other things different about us that set us apart from the other apes, and humans are a type of ape closely related to chimpanzees and bonobos. But we can do things that they can't do. For example, if you go to IKEA and buy a nightstand, it'll come in a box and it'll be in pieces. But if you look at the instructions and you follow them one by one, you'll wind up with a nightstand. No other animal can do that. So we have this tremendous, wonderful, beautiful ability that can go dangerously wrong when we misuse it. And as humans, we often misuse it. And I think the coronavirus pandemic that we're in the middle of is an example of misusing that gift and spreading things around in ways that we just shouldn't be doing.
First of all, I think I'm just going to do a little bit of a humorist edge that I'm going to add to what you said. Last night, I opened up a box, and inside of that box was something that I needed to construct. So me and my lovely partner, Alexandra, constructed this thing, and it turns out that it actually was for a non-human. It was for my cats, and I have 3 cats, and so we bought one of those cat hotels. It's like a multi-level scratching post kind of thing that had us screwing in stuff and tightening stuff and arranging stuff. And when we're done, we actually gave it to our non-humans because our non-humans wouldn't have been able to do it themselves. So thanks for referencing that this morning. I truly appreciate that.
Right.
Now, but saying more about getting on this idea of there's a rabbit hole here for us, Lawrence, if we go down the COVID line. So I'm going to ask us to see what are you interested in saying a little bit more about what you said about coronavirus and how that might represent us going awry in a direction a little bit?
Well, yes. I mean, if it weren't for intercontinental airline travel, this virus would never have gotten out of China, or it wouldn't have gotten very far out of China in the time that it did. But one of the things that I would like to address in a more general way is what deep survival is really about the first half of it concerns why smart people do stupid things. And this is a very interesting topic because we can have people who are tremendously smart and who make mistakes, and then they slap themselves in the forehead and say, why did I do that? And so that really is about half of deep survival. And the other half of it is once you've done this stupid thing and gotten yourself into a terrible position, how do you get out? And what makes you more likely to get out than the next guy? And so it is who lives, who dies, and why. But it's also all about the brain and all about how we think and make decisions. So it's seen a great deal of popularity, for example, among people who have to make decisions without complete information, like hedge fund managers, for example, or doctors who are treating a pandemic. And then just to briefly describe the sequel, Surviving Survival, that's about after it's all over and you've come out of it. How do you get back to your old life? And the answer is you don't, because your old life is not there anymore, and you have to reinvent yourself. And so that's what the sequel, Surviving Survival, is about.
Well, thank you. I didn't read the sequel, but as I told you before our talk, I did read the Deep Survival, and I read it through my Kindle and Audible combination. I was really moved by it and really moved about in the first half of the book, which was, as I see it, more or less like wild storytelling, like not wild storytelling, but wild stories as told. And of people who sometimes really smart or really equipped people making incredibly and often fatal decisions, and then other people who are maybe not so equipped or not expected to survive some sort of disaster, actually not only surviving, but thriving in that circumstance. Would you care to speak a little bit to that phenomena, maybe as an extension of what Deep Survival pointed to?
Yeah. Well, one of the things that I talk about in Deep Survival is the fact that in an emergency, you don't make up new behaviors. You do what you've done before. And so the result in a catastrophe or an emergency, a survival situation, is often that you discover you've been practicing something all along and never realized it. And so if you have been practicing the right thing, you will probably do the right thing. If you've been practicing the wrong thing, you won't. Here's an example. There was an FBI agent, and I'm not sure if this story is in the book or not. I can't remember. There was an FBI agent who decided that it would be useful to him to learn to snatch a gun out of someone's hand. And so he began practicing this, and he practiced and practiced and practiced, and he actually got really good at it. And, that was a tool in his toolbox that he had just learned for himself. Sure enough, one day he was out on the street and a guy pulled a gun on him, and he snatched the gun out of the guy's hand before the guy could pull the trigger. And then he gave the gun back. Now, of course, in hindsight, he understood, and he was terribly shocked by this behavior. His own behavior shocked him. His partner had to shoot the guy. But looking back, he realized, of course, that's how he practiced. He'd snatch it from his partner, he'd give it back, he'd snatch it, he'd give it back. And this opens up a whole area of human behavior that's fascinating, which is how we make everything automatic. Think about this. If we have a grandson who's about to turn 4, and we're trying to teach him to tie his shoe, it's very difficult. It's very laborious. You teach him step by little step, and he tries it, and he fails, and he tries it, and he fails. But he has to do it by rote, just like putting together the IKEA nightstand or the cat hotel. You have to do it step by step at first. But there comes a point where suddenly he gets it. He's taken all these little steps, he's put them together, and now all of a sudden he knows how to tie his shoelace. Well, that's a really remarkable thing because he has taken something that requires all of his concentration and turned it into something that requires none of his concentration.
That's true.
Which is it's kind of a miracle.
Yes.
But it's what we do with everything if we do it enough. So if you want to learn tennis, you're going to be like the 4-year-old trying to tie his shoe, and you're going to be flailing around. Somebody's going to have to be telling you where to put your hand, where to put your arm. But eventually you get it, and it becomes a tennis serve, and it's a beautiful thing. And it's completely automatic. And as you know, being a psychiatrist, I'm sure you know this, if you try to think through it, you'll ruin it.
Right. Oh, yeah. And trying doesn't seem to be an additive influence in any way, actually. That's right.
And so this is all part of our regular daily human life. So in the case of the FBI agent with the gun, he had been practicing something with a what they call a training scar. He had a piece of the training that was wrong. The important lesson is when the emergency happened, he didn't edit his behavior. He didn't invent new behavior. He did exactly what he had practiced. And that's what we all do.
Mm-hmm.
And so you have to be aware, like all of us are practicing something all the time without realizing it. What is it? And what will it do to us when we get into an emergency?
So this brings up a couple of questions for me, and I imagine maybe even for my listeners. There's something, so thanks for that succinct and beautiful explanation. I can really see the book shining through your speaking. So it's really beautiful to hear you speak. Thank you.
Thank you.
It seems to me that there is a type of practice, like I want to learn how to play tennis, or I want to learn how to I don't know, ride a bike or be a swordsman or something. There's a kind of practice that I get started with that isn't real. You know, I'm like, oh yeah, but this is just preparing for the real. And so that's sort of what it sounds like this FBI man had here. And here's your gun back. Let's try that again. Almost like he wanted, maybe he could do it 5 or 7 times with this man so he could really get it down. Or like as the practice, it was the idea that it was an exhibition season, that it wasn't a true, honest emergency. Maybe he was practicing for someday rather than practicing on real time. Do you see what I'm pointing to here? Like without the urgency or emergency during practice, are you risking not being ready when the emergency happens?
Yeah, there's a possibility of that too, but I'm thinking more along the lines of, think about this. You're stuck in a traffic jam. Now, how do you react? You're on your way to something important and you're stuck in a traffic jam. Are you going to pound the steering wheel and yell and scream? Or are you going to say, hey, guess what? I live in the United States of America and this is where traffic is. I think I'll just turn on my radio and listen to some classical music or practice my French or whatever, right? So if you're used to being calm in your regular life, it will help you to be calm in an emergency. And this is something that I think people lose sight of. They think they can behave one way in their regular life and then suddenly rip off the Clark Kent suit and become Superman in the emergency. And I don't believe that it happens that way. And so there's a kind of Zen element to the book Deep Survival in which I talk about staying calm. There's a place in the appendix of the book where I give 12 traits of excellent survivors. And the first one is perceive and believe. And it means when something bad happens, most people tend to deny it. That's the first reaction. The good survivor will say, you know what? I'm out here on this mountain and I just broke my leg. Something has to change in the way I relate to the world now because the world around me has changed suddenly. And then calmly go about it. So I'll tell you a survival story that didn't make it into the book because I met this guy too late. His name is Vitos Askunas, and he was in Grand Teton National Park one year, middle of winter, and was going to do a solo cross-country ski. So he parks in the parking lot, gets his skis on, takes his pack, and he goes. And about 5 miles out, he hit a little hill and turned wrong and suffered a really bad spiral fracture of his leg and ankle. So he sat down And he thought, okay, well, I'm 5 miles out, middle of winter, deep snow. Nobody's going to come out here. No cell phones at that time, nothing like that. I doubt he would have gotten reception anyway. So he takes his pack off. He opens his pack. He doesn't try to splint himself or anything. He takes everything out of his pack to assess what he has. Then he lights his stove. He makes himself a cup of hot tea, gets out some food, makes himself a meal, sets up his tent, and goes through all of his gear. Now, this is a guy who's reacting in a very logical way to a very highly emotional event. And there's a key here that, again, as a psychiatrist, you'll get this immediately. Emotion and reason tend to work like a seesaw. So if emotion is very high and stress is very high, you tend not to be able to think clearly. If you can get something going that works by the logical, stepwise part of the brain, the neocortex, the one that helps you put together the IKEA furniture, then you can bring that emotional level down, down, down until you can think clearly. And that's exactly what he was doing. So then he decided, here's what I need to take with me. I'm going to scoot on my butt, and I'm going to dedicate every 100 moves to someone or something back in my life that I love. So he did 100 moves, dedicated it to his wife. He did 100 moves, dedicated it to his guitar. He did 100 moves, dedicated it to his cats, and so on and so forth. And this is a crucially important part of his survival, and he did survive, is that he was socially connected to something back in the world where he wanted to go. So he had a high motivation to do this right and to get it done, block out the pain, and just focus on this is the world that I want to get back to, and I love all these things, and I love my life. And sure enough, he got to the parking lot, got in his car, and managed to get to a hospital and live. So this is a perfect kind of survival scenario, especially at a time like now when we're looking at something like having to stay home. My wife and I are basically homebound right now. And you think, oh, well, if only I could just go out and go to the grocery store, or maybe I'll just go out and get my hair cut. And we have to sit back and go like, no, this is like Bitos Escunas. We got to scoot on our butts for a while here and dedicate something to the life we want to get back to.
Thank you. I am hearing two things again that I want to bring to attention, which is that this in the practice, back to sort of an extension of the last thing we addressed together here, it seems like it's not a practice necessarily of what you do in any stressful situation, but that who you are, what you be in that situation. And in the world of psychology or psychiatry, this idea of being and doing being different than each other, that when you speak to calmness, that's more of a way of being in particular emergent situations than which lever to pull next or which button to hit next or which phone number to call next. You know, more or less what you're saying is that what I hear you saying is that you go into a state of mind that then delivers a certain level of being that then dictates your likelihood of survival one way or another. Is that accurate, or can you correct it if it's not?
Yeah. No, that's accurate. What you do becomes who you are, or you become what you do to a great extent. But it is a way of being in the world. And it's a way, so there, again, as a psychiatrist, you'll know about this literature probably that refers to the locus of control. There are people who go through life saying, oh, woe is me, this happened to me, and that happened to me, and bemoaning their fate. And they think like a victim. And there are other people in the world who feel like they have agency in the world and like, oh, I tripped and sprained my ankle. Instead of saying, I'm going to sue this store that I happen to be in front of, they say, wow, that was really stupid. I got to pick up my feet and be a little more careful about how I walk. And that person has what's known as an internal locus of control, right? And people who have an internal locus of control approach life that way. They approach life like, oh, that's broken, I can fix it. Or not, oh, that's broken, woe is me. And so developing this, and again, in the book, Deep Survival, I call it positive mental attitude, which is what the military uses. That's the term they use. And it is. I mean, that's what it is. It's like, you only go through life once, right? So how are you behaving? Is this what you want to be, this complainer? Or do you want to be the person who can take things in hand and make them right?
Exactly.
Exactly. I have, you bring up that you only go through life once, and when left in those situations, how you be, or who you've practiced to be up until the point, those situations meaning a survival situation, a catastrophe, tragedy, an accident, or natural disaster, etc. How one behaves is a function of how one has behaved, at least in practice up until that point. I have another question here, which really has been dogging me as I went through your book a little bit too, which is, I'm 62 years old. I've lived an amazing life, and I've been in two car wrecks, both of which are considered death-defying. I rolled a car into the woods going 90 miles an hour, side over side, and here I am. And that wasn't so much my personal skills, or maybe it was, I don't know. And I now have what I say is a life that doesn't have much of a bucket list left. Done what I've done and created what I've created and become who I've become. And I'm pleased to say that I'm at a space that's very enjoyable, having earned the stripes that I have to now be 62 years old and speak like this. Okay, here's my question. When I was a little more of a fledgling youngster, I feel like I was tenacious on the edges, wanting to live, absolutely among all else, like the desire to live and desire to sidestep all troubles was the way I went through every day. I wonder if that's been decreased recently. If somehow I'm like, yeah, when my time comes, can one lose their interest in surviving a tragedy? I guess that's what I'm saying. And what really shows up at flash time? Have you done any looking at that? So can one, lose their motivation? Like maybe I'm okay now. Maybe it's time to go, or something like that.
Yes, of course. My wife and I went through recently her mother's death at the age of 93. And Debbie and her mom were like sisters. They would go to Florida every spring. They palled around together. Debbie would call her almost every day, and they'd chat for half an hour or an hour. And so this was a big deal. But in the recent time, like about a year maybe, Margaret, her mother, had just gotten to the point her health was so bad and she was in pain all the time. She had congestive heart failure. She was in and out of the hospital. And she had really said to me and Debbie, I'm done. I'm through. And legitimately, I mean, she wasn't suicidal. She wasn't depressed. She was 93. And she did pass away in February. And it was like we had all been through a year or so of watching her suffer and thinking, gosh, this is no fun anymore. So yes, I believe it's true. I'm not sure. I mean, I'm 72 and I'm not sure I'm done. Yeah. I don't exactly have a bucket list because I've led a very full, exciting life, but I've got these wonderful grandkids, and I'm married to a wonderful woman, and I have my writing, and I have people like you to talk to about the things that are important to me. And so I'm here I am stuck at home in the middle of a pandemic, and I'm really lucky because I get to talk to you, so how great is that?
It is great. And I think what I'm really pointing to is the quality of the vigor. In other words, I'm really interested in living. Last night I was taking my nightly walk, and I was thinking about today's conversation with you. And I was like, oh, and that was before I built the cat hotel, by the way. And I was wondering, in some ways, if pressed into a survival situation, perhaps, maybe, hopefully not like the level that you speak of in your books, that there's even a greater interest in living here, even though there's sort of like a calmness about, well, maybe I'll live and maybe I won't. That wasn't there when I was a child or even a teenager or an adult. Now there's like a calm truth to, I might not live through this one. And that doesn't mean that I'm less interested in living. In some ways, it's being more in touch with the reality of the circumstances.
Well, in one of the stories in Deep Survival, I talk about a guy who did in fact break his leg on a mountain.
I know. Oh my goodness.
And his approach was very much like that. His approach was, I'm in Peru. I'm at 19,000 feet on a snow-covered mountain. My leg is broken. I'm dead. However, and this is the important part, even though I think I'm probably going to die, I'm just going to do the next thing I can do.
Exactly.
And he does every day. And this, I think, took him, I forget, like 3 days to get down. But he just did the next thing, the next right thing in front of him. And every day he was saying, I might die today. I probably should die today, but I think I'll just do the next thing I'm capable of doing. And he got out.
Yeah. In some ways, that's just how I live every minute of life.
Yes.
It's like, really, it's like, okay, I don't know. I have no effing idea what's up here at all. I have no, what I just did is kind of pointless or useless. I don't even know what direction I'm facing. I might as well just do the next right thing.
Well, one of the things that people who read Flight 232 come back to me with is this idea of like, well, it can be taken away from us in an instant. We live in a contingent world where, you can walk out on the street and get hit by a bus. And so you want to keep two things in mind. One is you don't want to be hit by the bus and then be lying in the gutter thinking, I should have had the ice cream. Go ahead and have the ice cream. And the other thing is you shouldn't be taking your life for granted when you live in a world where you might die at any moment. You should be enjoying every bit of it.
Last night, and now, now that you've become essentially a friend of mine, last night, we got to walk, and then we got the building of the hotel, and then I was lying in bed at midnight. I don't know if you know this, but around midnight last night here in California, there was an earthquake.
Oh, no, I didn't.
Yeah, it wasn't. I was lying. I was hugging, my partner, and we just really had just drifted off to sleep. And I'm not from California originally. I'm from Michigan, and I've lived here for a few years. But I was I was awakened by an earthquake.
Yeah,
and it was like, holy cow! And the bed shaking.
Yeah.
And it's like, oh, this could be it. Like, this could be it.
Yeah.
It turned out to be a 3.87 miles from here, but it was like,
yeah,
wow, this could be it. There's this right now. This is a good indication that on any given second, like right from, all we need is a 7.6 right now, and voila, that's it.
So what part of California are you in?
I'm in Los Angeles.
Yeah. Okay.
Yeah.
Yeah. I've been in earthquakes there too. And if you're from the Midwest, like I am, it wakes you right up.
It does. It does. And there was something that Alexandra said to me, which was, there's an opportunity when your world shakes like this to pray from deep inside your core. Like it isn't really praying for mercy. It's about acknowledging something about survival, about living, about taking that next breath, about not taking anything for granted right now while the world is shaking.
Yeah.
It's fascinating. It was really quite beautiful.
I talk about that in Deep Survival, and I talk about a firefighter named Peter Leshak, who wrote a wonderful book called Ghosts of the Fireground, in which he talks about praying, as a firefighter, getting stuck in a life-threatening situation is a very real and proximate thing for you. And he's been in a number of those. And he says, praying for me isn't about God. It's about sort of silently acknowledging the reality of your situation and embracing it and saying, okay, this is the real situation. Now I'm going to do whatever I can do that's next. And this,
it's like a settling, like a resetting or something, like a grounding.
Right.
Yes. We're on with Lawrence Gonzalez, the writer of Deep Survival. You mentioned that you also share with me that you don't have much of a bucket list, but you don't think you're done. You have your grandchildren, you got your writing, you got many things, conversations with other people. You have who knows what's coming around the corner, and that you've lived an extraordinary life. And along with your relationship with your father, which I invite you to take on now if you'd like, I'd like you to point to one or two things in your life that our listeners might be able to enjoy with you or appreciate with you that have led you to be the master in this particular area of study that you have become. So what kind of things contributed to Lawrence Gonzalez being Lawrence Gonzalez, the writer of these books and the speaker to these aspects of what it means to live through tragedies and disasters?
So when I was a little kid, I began hearing about my father's experience in World War II. When I was a real little kid, I can remember I was probably 3 or 4, and I was short, so I was looking at my father at about shin or knee level, and his legs were covered with scars. And I always wondered about, and his feet were deformed too. And I wondered what had happened to my father. And as I grew up, I learned more and more. He was shot down over Germany. He was a B-17 pilot during World War II, and he was shot down over Germany and fell 27,000 feet without a parachute. And this story is told in Deep Survival in some detail. But the long and the short of it was that he was very severely injured and was recuperating when I was born. I was born in 1947, so the war had just ended. He was still an injured pilot. Well, I grew up very interested in aviation. So when I became a journalist in the early 70s, I began investigating airline crashes. And the NTSB, the National Transportation Safety Board, investigates those crashes and does the official report on them. And I was kind of dissatisfied with the way these reports would read, because I would say, well, here we've got this pilot of this airliner. He's an ex-military guy. He flew fighter planes. He's got 30,000 hours of experience. He's got a master's in engineering. This is a really smart guy. So how did he manage to do the stupidest thing that a pilot can do and drive his plane into the ground? And they would say to me, well, we don't know because he's dead and we can't interview him. And so we leave that part out. And I thought, well, wait a minute, that's the most interesting part. Most interesting part is not the mechanical aspects of the accident. It's like, what was this guy thinking when he drove his plane into the Everglades or wherever it was?
Yeah.
And so that really started my career. So between my father, one of the big questions with my father was, if he had been killed in the war, I wouldn't be here. And of course, me being a little kid and the most important person in the world, that was a profound thought to have, thinking it was an existential thing for a little kid to think about. What if I wasn't here? And the other thing was, well, why did he survive and the rest of his crew got killed? Which I think the answer to that one is just it was chance. But it started me on the road of thinking both about airplanes and about survival.
Doesn't he have a line about lucky?
Yeah, he would say he was just lucky. And one of the things that we know from success in business is that the most successful business people, when they ask, well, how did you do it? They'll say, I was just lucky. And I think that a survivor's attitude is humility. And part of that is not beating your chest. The experts say the Rambo types are the first to go. Humility is very important. And part of that is admitting, like, yeah, there's a lot of luck involved in this.
Thank you for that. Here comes the next part of your life. What is this? How does it unfold from here? And where do you start getting like some traction into not only looking for these things, but coming up with things and then loud and clear enough to be able to deliver to us others?
So from studying airline accidents and reporting on them, I began to look at other kinds of mishaps and began to realize that big accidents are organized. They're not chance. You'll see something in the newspaper that says, oh, it was a freak accident. It was an act of God. And I started to say, wait a minute, I see commonalities among like an accident like the space shuttle and a plane crash, or an accident like the space shuttle. I'm actually working on something right now that is attempting to show the similarities among three things. One is the 2 space shuttle accidents. The other is the destruction of the Great Lakes, which has been going on for more than 100 years. And the third is the coronavirus. And all of those three categories are connected because they basically violate the 12 rules of survival that I have in Deep Survival, starting with perceive and believe. And without going into a great deal of detail, basically, in the case of the space shuttle, they saw things happening that were not designed to happen, and they refused to believe that it mattered. With the Great Lakes, they saw things happening that they knew were really bad, like invasive species, and they refused to believe that it mattered. I mean, look, Lake Michigan's 400 miles long. How can a little fish change it? Well, it did. And the third, the coronavirus, is they saw it in China and they went, well, we don't really have to worry about this too much. And the result is what we're living with now. So in all three of these cases, it's people's thinking that got them into trouble. And so this, going back to a time, say, in the 1980s, a couple of things began happening that influenced my work in survival. One was the publication of a book by Charles Perrault called Normal Accidents. I believe it was in 1984. And Charles Perrault put forth the theory that in very complex systems, accidents aren't accidents. They're part of the way the system functions. If you build an aircraft carrier, you're building accidents into the system because it's so complicated. It has so many moving parts. It can't avoid accidents. And so if you have an accident and you say, oh, here's a fix for it, we'll put some more technology on it, you may just be making the situation worse by making the system more complicated. And so this is an element of survival that began feeding into my work. The other thing that happened was along about that time, they started developing brain imaging technologies that became MRI and positron emission tomography and various ways of looking at the brain functioning so that we could go back and start to answer that question that I asked about the pilot. Why did he drive his plane into the ground? Well, you can now look at the brain and see how it's functioning and say, aha, here's a part of the brain that lights up when you're scared, and it's called the amygdala, and it stops you from doing things that you might otherwise do to help yourself, and it makes you react in an automatic way.
You reference on a couple of occasions sort of this automaticity of at least butted up against when you speak about the space shuttle accidents. Even given like an overwhelming amount of information that my next step, if I was to take it, is totally dangerous and perhaps even deadly, if my motivation is such that I want what I was going after anyways, I will be blind to that level of overt, obvious information that makes that next move untenable. And I do it anyways, and then I'm dead. Like, what is up with that? What is it? Tell us a little more about that level of blindness.
Well, again, it's the seesaw of emotion and reason. And the emotional system is one of several systems that protect us. It's constantly gauging the safety and danger of the world around us and constantly monitoring and motivating our behavior in relationship to it. So everybody's had this experience. I'm here alone in the house with my wife, but it's very possible and has already happened that I come around a corner and I think she's up in her office, whereas actually she's walking down the hall. And as I come around the corner, I come face to face with her and I go, oh my gosh. And my heart's beating and my blood pressure shoots up. My muscle tension changes. I have this tremendous boost of adrenaline and I say, you scared me. And then we both laugh. And this is a complete emotional sequence that we're all familiar with. And my intellectual knowledge of my situation does me no good. I know that I'm at home. I know there's nobody here but my wife. I know there are no bears in this house. And so what am I reacting to? And this is the nature of that automatic system to hijack our behavior in an emergency. And it's evolved this way over millions of years because it works most of the time. So on a statistical basis over millions of years, more people survive by using it than by not using it. So we're stuck with it now. And that's what exactly you're talking about. You get that emotional motivation to do something, and before you know it, you've done it. And you look back and you think, wow, that was really stupid. Why did I do that? If you live through it.
Yeah. Like I think the kayak story with the flooding, it's like they have every tool necessary to determine that this is not a good day to be on the river. And I mean, like not even close to an acceptable day to be on the river. Yet brilliant people with tons of experience make a decision to go out on the river anyways.
Right. And what I say in Deep Survival is saying that someone is experienced may just mean that person has done the wrong thing more times than you have.
Exactly.
And people always say this, and they're saying it right now today. Every day on the TV, I'm hearing this. Like, well, we've always done it this way before, and nothing bad has ever happened. Right. That's right. Statistically, you've been lucky.
Right. Incredible.
And so right now in Georgia, I hear they're opening up bowling alleys and tattoo parlors. It's like, good luck with that.
Yeah, I saw Sanjay Gupta on TV just yesterday. One of the few things I saw was him. I don't watch much, but I did see him. He's from Georgia, speaking to that, and yeah, we'll see how that goes.
Yeah.
All right, we're gonna begin to wind this down. One of the questions, is there any questions that well, let's put it this way. Is there anything that we haven't addressed or that you'd like to bring forth, either as a question to me or maybe an open question to the listeners, something to think about, something that where you're at in your evaluation or your exploration, or maybe even your recommendation during these times, having to do with the coronavirus, or maybe just having to do with being a 72-year-old grandfather and talking to the truth? Anything you want to say?
Well, I'll speak to being a 72-year-old grandfather, or any age grandfather, that I have learned so much over my lifetime from my children and now my grandchildren. And when I first had children, I didn't know a lot of the things that I know now. My elder daughter, Elena, was born in 81, and I didn't know how smart kids were, and I didn't know how complete they were as human beings. And they're not proto-human beings. They're fully fledged human beings, and they have these handicaps, one of which is they can't talk initially, and they can't walk, and they have to develop all this muscular coordination and such. But they know so much that's going on, and we can really learn from our children. And now with the grandchildren, I'm paying so much more attention and really listening to what they have to say and watching their behavior. And the kids are having a blast. So both my daughters are at home. They both have 2 kids, a boy and a girl each. And they are playing with their kids and listening to their kids and doing things with their kids and inventing lessons with their kids. And everybody is having a really good time. And to me, not everyone can do that. My mother, by the way, is 99 years old and in a nursing home. She doesn't have the same ability to connect that we have, people calling her on the phone and things like that. But she's in a kind of isolated group home. But with the grandkids, I try to get on Skype or Zoom or one of the visual connections we have wonderfully today and read them stories. Or I'm playing chess with my 8-year-old grandson. Things like that are extremely important right now. And those who have access to them need to do that. But the other thing is just to realize, essentially, I'm old enough to remember my parents talking about what it was like during the Depression, what it was like during the war. And we're in a situation like that right now. You can't just throw a switch and undo what's happened. We're going to have to live through it. We're going to have to be very patient and calm to get through it in one piece.
Yes, it really does take all kinds, but it does seem like calmness in the face of adversity certainly seems like a virtue. It certainly seems like something worth bringing forth when and if it's available. And if it's not available, then making it available. Calmness seems important.
Yes. And now is the time to do those things you always wanted to do, like learning to paint or learning French or starting to do yoga, whatever. There must be something that you've dreamed about doing. Learn to knit. And I will talk very briefly about 2 circuits, 2 pathways in the brain that are very important to think about. Not every neuroscientist agrees on the terminology, but some of them call this one pathway the rage pathway. It's very easy to see. You just step on your cat's tail by accident and you'll see it. The rage circuit, the claws come out, the screaming happens, the struggling, the grimacing. All of that is automatically activated by this series of places in the brain that they call the rage circuit. You can see another bit of evidence in a cat's behavior when the cat is stalking prey. The cat will get low to the ground, very goal-oriented, quiet, rhythmic behavior, and it can't make noise or it'll never catch any prey. So this circuit, called the seeking circuit, disables the rage circuit. And so because they go through some of the same areas of the brain, you can't have both at the same time. Humans are very good at finding activities that activate the seeking circuit, such as knitting, playing sports, running, playing a musical instrument. These are all things, depending on what you like, that can absorb your attention. And every one of us is familiar with saying, like, oh, when I'm playing piano, I just kind of lose myself. And that's what's happening because the rage circuit can't happen. And if you're afraid and in a dangerous situation, you're starting to activate that rage circuit. You're getting antsy and irritable. You find something that activates the seeking circuit.
That's brilliant. I totally get it. Part of who I am for my patients is something called The Create. It's a book I wrote, and it's in audio form. It's just coming out this week, actually, called The Creative 8. Really built on what you're saying, which is that most of the symptomology or the psychological discomfort that we experience as a result of, or can be combated or counteracted with just being creative, creating from nothing, art, music, dancing, singing, drama, cooking, writing, gardening, those kinds of things that really
once we sit down and start creating from nowhere, it does seem like it doesn't just seem like it. The concerns that we had that led up to it just dissolve instantaneously in many cases. So
Yeah,
yeah,
exactly. And everybody can find that activity that does that.
it's really great. One of the questions we like to ask our guests before closing, and I think you probably saw it when dealing to set up today's talk, is if there's one thing going on in the world that really does bother you, that really still tweaks you, that really has it be it's what you wake up and think, I sure wish that this would be different, or I sure wish I could make a difference there. Is there anything that you can think of that really, takes the lead among all others about something going on in the world that you really feel committed and dedicated to stating is an issue that tweaks you?
Well, I think it is exactly what I talk about in these books, Deep Survival, Surviving Survival, and so on. And it is that people are most of the time not paying attention to what's going on around them. And they're not believing the evidence of their senses. And so they're living mindless lives instead of mindful lives. And it's exactly this kind of lack of thinking, lack of paying attention that leads us into the kinds of troubles we're in so many ways. I mean, not just the coronavirus, which will eventually go away. Global warming will not go away. Climate change, if you like to call it that. And the Great Lakes will not reinvent themselves, which is 20% of the fresh water in the world. This is a very important thing. Water in general is the next nuclear war, as far as I'm concerned. But all of this comes down to one thing, which is living aware. Awareness.
I was hoping that was going to be your word. Got it. Yeah.
And this is a Zen practice.
And how do we do that? How do we do that? As us unaware folks, us people who are just buzzing through the world, just getting it done, not really looking around us. How would you instruct us, as if I'm one of them, to put a higher acuity?
It goes back to the thing I talked about, automatic behavior. How do you learn to tie your shoes? And you learn to tie your shoes by stopping thinking about it. And we live our whole lives without thinking about it. And so you have to be able to literally go out, and my wife and I do this all the time, go out and look at a tree and say, my God, that is a beautiful tree. Look at the tree. Look at the way that tree has grown, and look at the form that it takes, the amazing fractal complexity of that thing and how it's processing energy. And you start to take your little world that you live in and start seeing the things in it as a practice of becoming aware of the rest of the world. Mm-hmm. And you start, and I talk about this in Deep Survival, you start asking questions such as, what's really going on here? I'm coming down this trail in Glacier National Park, and there's a big pile of bear scat on the trail steaming, and I walk right by it. Now, wait a minute. Where did that come from? There must be a bear here. And I'm speaking metaphorically, of course, working hard to get out of automatic behavior and into perceiving and believing what's really going on in your world. It's hard to do.
Sure. And what's the alternative?
You just glide through your life and the bus hits you.
Yeah, exactly.
And the bus might be cancer, and it might be coronavirus, and it might be something else. It might be any number of things. But the point is, you miss life. You don't want to wake up and be 90 years old and say, wow, I missed the whole thing. I had my iPhone to my eye, and I wasn't watching. I was going to catch my life on reruns.
Right. Well, I can say with some degree of authority, having now spoken with you, and it really has been a gift and an honor to have this conversation with you, that at least in our case, we have lived lives that are valuable. And we've reached a point now where we're pouring it back, or that we're committed to at least speaking to what we know, and which isn't very much ultimately, and nevertheless really continue to receive and then give it right back, pour it right back. Exactly. And it's all I'm about. Yeah. I really noticed I'm so looking forward to the next third or maybe even quarter of my life that is in front of me for me to just pour it right back.
And let me just add to that if you are in the position of giving as opposed to taking, it makes you much more powerful and it makes you a better survivor. If you can find someone in this situation who needs your help, and I'm speaking to the audience here, that you can help somebody like that, it's so much more useful to your survival, and you're getting through this thing to have someone to help. And so find somebody who's worse off than you are.
That's a really great point. The end of the Creative Eight. So that I just said, the Creative Eight was art, music, dancing, singing, drama, cooking, writing, and gardening. Those are the original 8. Then there were 2 more that were added on, which was photography and cleaning in the big form. And then the 11th one, the Trump card, if you will, is help anybody do anything. And I think that's what you're speaking of. That's the one that works if all 10 of the others are somehow not available. Like, just bring that on, and that is a guarantee to work. And that's I'm with you 100% there.
Yeah. It makes you a rescuer instead of a victim.
It really does. And back to internal versus external locus of control, you really get an opportunity to have an internal locus of control and make a difference.
Yeah.
All right. Well, Lawrence Gonzalez has been with us. What an awesome conversation. Thank you so much. It has been a deep pleasure. And to my listeners, I just want to, what did you get from today? And there's something like, there's an opportunity here to get something for yourself. I mean, you can look at Lawrence Gonzalez and say, he's that kind of guy. Or maybe even look at me and say, yeah, but that's Dr. Fred. He's that kind of guy. But the real situation here is you're that kind of person, whoever you are. And there's just some things I think we touched on maybe intentionally and inadvertently today, Lawrence, that are going to maybe tweak our guests into looking at their lives a different way. And my goodness, if there are some people who wish that they could do that even once in their lives. And I think we just got to do that in today's conversation. So I'm totally grateful. Thank you for having this conversation.
Thank you.
Yes, sir.
Thank you. I've really enjoyed talking to you.
It's been beautiful. We are indeed in the midst of the coronavirus lockdown or quarantine or stay at home. And it's an incredibly gorgeous day here on planet Earth. And I, like Lawrence Gonzalez, am deeply proud to be a human and to be here with you. And take care of yourself, take care of your family, take care of the people around you, and get some rest. But when the time comes, just do the next right thing. Thanks so much for tuning in today. So one of the things I really want to point out about today's interview was, like, this man has really been on the edges with people that have actually survived unthinkable circumstances and with people who haven't. And he's so smooth and easy with just discussing the truths on these, like, human edge. And for me, just going out on those limbs and going out with him really gives me a visual and, I don't know, a full sensual experience of what it is to survive. And he's done his research. And so, wow, now I know some of the traits that it would take to survive some of those disasters and catastrophes. Amazing guy, and so much fun to talk to. Perhaps as you were listening to this, you thought of maybe someone you know who really could benefit from this episode. So go ahead and reach out to them right now and invite them to listen and to subscribe to the Welcome to Humanity podcast. And while you're at it, well, why don't you hit the subscribe button on your podcast player? Once you do that, you'll be able to get the latest episodes as they become available. And on top of that, if you really enjoyed this or other podcasts that you've listened to in the Welcome to Humanity bunch, could you just take a few minutes and leave a review on Apple Podcasts? We'd all really appreciate that. I'd be truly grateful for that support. Also, to catch up on past episodes, head on over to the welcometohumanity.net/podcast. Until then, this is Dr. Fred, and this has been another wonderful version of the Welcome to Humanity podcast broadcast. Thank you so much for listening. Have an awesome day.
This is the Welcome to Humanity podcast with thought leader and transformative psychiatrist, Dr. Fred Moss. This show focuses on the betterment of humanity on a global scale. Each episode will leave you enlightened, inspired, and ready to make an impact in your world. Welcome to the show. Welcome to your life. Welcome to humanity. Here's Dr. Fred.
So welcome to the show, my Welcome to Humanity podcast followers and others. Like, welcome to the show. Welcome to what we have here. Where we are at Welcome to Humanity is we just interview the finest people on the planet, and we interview those people as a sample for what humanity has to offer. Now, I'm not saying I have access to the finest people on the planet, but I am saying that sometimes I do. And as a result of having access to the finest people on the planet, I like to share them with my audience so that we can see different samples of what it really means to be a human being. And this is more than conceptual. This is actually an opportunity to get a taste, a real taste of what it is to be a human being in these difficult and beautiful times. So with all of that said, I have a guest today that, in my opinion, is perhaps the finest human being I have ever met. Now, she doesn't really know that to be the case all the time, although I have told her on various occasions that that's close to true. But as I sit here today, having prepared for this interview for almost exactly 20 hours, I am here to tell you that the person I'm interviewing today is perhaps the finest example of what a human being is in this day and times as anybody I have ever heard of or anybody I have ever met. Now, that's a pretty large, lofty introduction. And I'm going to redouble down on it and say that I meant every word that I said. So that's who I'm interviewing today. That's who's with us. So today we have Isabella Levesque. Now, some of you are thinking, oh, man, I was kind of hoping it was someone I ever heard of. This is someone who maybe you'll hear of someday, but this isn't her goal. You'll learn more about Isabella in just a moment. I have some level of bio on Isabella, some level on introduction on Isabella. Who is this Isabella for the world? You know, I know her father and mother, for instance, and that's really my introduction pathway to Isabella. Is very close with her father, and her father's part of the production, in fact, of this particular episode and all the episodes and even the creation of this particular podcast as an entity. Her father is my partner, Ryan Levesque. Her mother is Ryan's wife and her mother, and that's Melissa Levesque. And that's the family that they have with there. And they have a couple rabbits, just to be honest. And they have a couple rabbits, and Isabella and Melissa and Ryan. And Isabella runs the program. And Isabella doesn't just run the program in the household. I don't want to loft her up too much, but this is a spectacular woman that we're about to share her world with. So without further ado, after a large introduction, my job today is to showcase one of the most, if not the most spectacular human being I have ever met. Welcome to the show, Isabella Levesque.
Hi, Dr. Fred. Thank you so much for introducing me. So as you know, I'm Isabella Levesque. I am 10 and a half years old, and I will be turning 11 in 1 month.
Okay. Pretty soon you could start saying you're almost 11 instead of going with this old school 10 and a half stuff.
Yeah, like I'm almost 11. Okay.
That's better.
That.
I'll let you go there. Go ahead.
I'm Isabella. I have 2 rabbits named Buster and Thumper.
I have Valentino, my oldest cat, and then I have the middle dude. That's Despacito. Right. And then I have the youngest one. Remember his name? His name is Winston.
Yeah.
Mm-hmm. Tell my viewers a little bit more about like who you are. What do you do? I mean, a good day. You're on one side of this country. I'm on the other side of the country. I guess you're in, where are you? What city are you in now?
I'm in Massachusetts.
You're in Massachusetts, right? And I'm in Los Angeles, so almost 3,000 miles away. And we're here kind of on lockdown, aren't we? Kind of on quarantine. So before we dive into today's conversation with my wonderful guest, Isabella Levesque, I want to just take a minute to let you know that I just finished putting together this audiobook version of my book called Creative 8. So this book teaches a surprisingly easy method for healing that uses creativity and self-expression as its primary modalities. And as a listener to the Welcome Humanity podcast, I just want to offer you a completely free copy of this audiobook as a big thank you for listening to the show. All you need to do is go to welcometohumanity.net/creative to download it. I've used this Creative 8 methodology with both psychiatric patients and with my coaching clients with just awesome results. The method actually takes less than 5 minutes a day to implement, and it really works. Go ahead and listen. I think you're going to love it. Download your free copy of the Creative 8 audiobook today at welcometohumanity.net/creative. Now, back to our conversation with Isabella. Can't wait. Welcome to humanity. Outside of that, what is your life about?
Well, I love dance.
Oh.
I love to do dance, swimming, and gymnastics.
Okay. That's spectacular. Say more about dance.
I used to do ballet and tap. Now I only do 2 dances now. I do lyrical, which is a kind of combination of ballet and modern.
Mm-hmm.
And I also do acrobatics.
Did you say lyrical? Is that the first one?
Yes.
Okay, lyrical and acrobatic. Now, help my listeners know what that is. We all kind of have a clue, even dancers, of what, some of us are dancers and some of us are not. I for one, am not really a formal dancer. So I see ballet and tap. Everyone knows about those. But I think once you start talking at the next level here about lyrical, or what was the other one?
Acrobatics.
Acrobatic, that we're not so sure what that means. Can you give us a little clue what either of those things mean and how they differ from other dances?
Well, in lyrical, it's like ballet. You sort of use the same shoes.
Okay.
It's like a mixture of like calming music and like very calm and pretty music.
Pretty music.
Pretty, yeah.
Mm-hmm. So different than ballet, based more on the music that you're hearing when you go through the steps rather than, yes?
Yeah, yes, correct.
Okay, but you use similar shoes, or one could get away with dancing lyrically with ballet shoes on. Is that correct? Or is there such thing as lyrical dance shoes?
Yes,
there is.
All of my teachers call them foot undies.
Oh. Foot undies.
Because they look like little undies that go on your feet.
I see. Okay. So what makes those different than ballet shoes? And then again, with this pretty music and these steps, there's something a little bit different here between lyrical, which seems like a contemporary or a more current form.
Yeah, it's kind of like contemporary.
Contemporary. I see.
There's a lot of like jumping, leaps, rolling, a lot of gracefulness.
I see. So even the gracefulness aspects maybe that come from ballet are accentuated in the lyrical dance steps, yes?
Yes.
Okay. All right. So are these songs that we would know, or, when I hear lyrical, Isabella, I think about song. I think about words, lyrics. I think about singing. Somehow my mind goes to singing when I hear the word lyrical. Is there anything about this type of dance that actually includes singing, or am I just off base?
You are not off base. There is singing in the songs.
Ah, so you as the dancer sings as well?
I don't sing in the dance.
Help me out.
But the music, there's singing in the music.
I see. There's singing in the music.
Yeah.
I get it. And so in ballet, there's not necessarily singing in the music, but in lyrical, there tends to be singing in the music, yes?
Mostly in ballet, like for the kindergartners, first graders, and stuff like that, they have words in their ballet music, but when you start to get older, it starts to go into just like classical and stuff like that.
Yeah, right. Okay.
Music, yeah.
Or different operas or those kinds of things.
Yes. Yeah.
Right. Mm-hmm. Okay. All right. I think that covers lyrical for now. And what's your thoughts about lyrical? Is it your favorite, or which of the 4, if we had to choose between ballet and tap and lyrical and acrobatic, which of those would you say are the ones you tend to, like if you had a choice to pick one right now, which one would it be?
Acrobat.
Oh, great. So this is a great setup for the next set of questions, because I was actually running out of questions here. So I have a good one here. Tell us a little bit about acrobatic dance.
So acrobatics is kind of like gymnastics.
Mm-hmm.
Like doing cartwheels and back handsprings and flips. But it's more advanced. So the one that I'm on the level I'm in is an advanced level.
So you're saying, this for my listeners, I think I understood what you're saying, but let me just make a clarity. Go ahead.
My level is more advanced than most acro classes.
So acrobatics in and of itself is an advanced form of gymnastics, and Isabella, by yourself, is in a somewhat advanced form of acrobatic dancing. Is that fair?
Yeah. And
okay.
Where I go for that kind of special class, you have to be invited.
Mm-hmm.
And I was specially invited to it.
Wow. That's a very high honor, and congratulations on top of that. It took something, I guess.
Thank you.
They probably wouldn't invite me based on my present skill set. Yeah. All right. Well, I have a little work to do before I get a formal invitation to be in an acrobatic dance.
Yeah.
All right. I understand that. And so this one is your favorite, though. So we're talking about handstands and back springs and flips, and you're able to do that without a problem, and even do that to the beat of a sound in the background. Yes,
Yeah, pretty much. I can't do a complete flip, but I can do a back handspring.
Can you go into a back handstand, like boom, like just bend backwards, and all of a sudden you're in jump back into a back handstand? Is that what you're thinking?
Yeah, pretty much. Yeah.
Wow.
I can do that.
You know, I just to let you know, I mean, you've met me a few times. I personally, I'm not able to do that. I'm just letting you know that. I don't know how to do that. I can do a lot of things in my life, but one of the things that I haven't quite mastered yet is going from a standing position to a back handstand, or even getting into a back handstand if someone held me up. I'm pretty sure I couldn't do that either. So
yeah,
I'd probably cause some damage. So it's good that somebody can do it. And that sounds like that's one of the things you do. So that's great. So there's some of the issues, some of the ways that you dance, but you know what? You already said you're way more than a dancer, although dancing is one of the many things you love to do.
Yes.
All right. Let's try to pick something else. What else are you about?
I also love to do swimming.
You know, I am a swimmer. So now we're talking my language, and go ahead and tell my listeners a little bit more about swimming.
So I am in almost team swimming. I am almost competing. I'm preparing for team. It's called prep team, or...
What is it called?
I forgot what the other name was called.
Okay, no problem. So tell me a little bit about what that means to be a 10 and a half year, an almost 11-year-old who's in this competitive swimming stage, along with everything else you're doing. What are your strokes? What are they calling on you to do? When the pools are open, what kind of practice do you do? What's those kind of things?
Well, we have a lot of warm-ups to do. So that's why you need to get there early to start warming up in the pool. Mm-hmm. And then she tells us to do you know what freestyle is, right?
Oh yeah, I'm familiar with
Yeah, okay. Yeah. She asks us to do maybe 2 laps around the pool, or 2 laps up and down the pool of freestyle. Mm-hmm. Or 3 laps up and down the pool in butterfly.
Can you just do butterfly 3 laps without much of a problem?
Yeah, I can do that, yep.
That's pretty outstanding. You get that. Here's another place, Isabella, just to let you know, the chance of me doing 3 laps of the butterfly anytime in the next few years or lifetimes is pretty small. I'm not doing a whole host of butterfly.
Yeah.
You know that, right?
Yes, yeah.
And most of my listeners can't do the butterfly either, just letting you know. Yeah. Some can. I have a particular listener or two in mind that I know does do the butterfly, but in general, doing a butterfly along with all the strokes. Do you do all 4 strokes? Do you do the breaststroke and the backstroke as well?
Mm-hmm.
I see. Wow.
I can dive.
Oh, now we're talking. What's that look like? Is that from what size board? Is that a 3-meter board or a 1-meter board? Do you know?
It's pretty high.
3 meters, maybe. Mm-hmm.
Yeah, maybe 2-3 meters.
Uh-huh.
It's high. It took me a long time to get used to that.
Right.
I used to stand in the position, and I used to lean forward but not go.
Right.
And I was like, what the heck am I doing?
Right.
And finally I got it, but I did a little belly flop.
So, Isabella, I'm going to focus on a particular thing. It feels like I got a little fish on the line here. So I'm going to focus on a little area and ask you some questions, and we'll see. I'd like you to answer from your natural self. You and I have had some fun conversations, and I think you'll see that where I am here will be another fun conversation, okay? You can trust me for that.
Yep.
Where I'd like to talk about is you being up on the high diving board and looking out over the edge and going with, wait a second, what the heck? How did I get here? And then dealing with it, looking over, stepping back, looking over, stepping back, and eventually then making a decision to go for it. And now actually being someone who can start a sentence with, I can dive. Okay. So there's like some progression there, right? We've gone from not being able to dive to getting up to that board, looking over the edge and thinking, I don't think so. And getting over all of yourself and all your fears and all your concerns and all your worries. And then actually taking that leap off the board and now getting to the point where you would say, where you already have said that you're a diver, you can dive, right? Do you follow what I'm saying there?
Yes, I do.
Is that, first of all, is that consistent with what your experience is? Am I properly describing how it went?
You are. You are.
Okay.
You're making memories come back to me.
Okay, that's exactly what I'm asking for. So what I'd like you to do is go freestyle right now, go full freestyle on your own and talk to my listeners, because we all have life events that look a whole lot like jumping off a diving board. Now, you may not know that, but us adults, we have life events that feel like exactly what it is you're talking about with a diving board, where we're faced off with something. We don't know how we got here. We don't know how we're going to do it. We look off to the edge. Going backward is not an option. We don't think we can. And then we sort of think we should. And then we think we better. It's the only ever people have done it, whatever we think. And then boom, we do it. And then we become somebody who can say, I did it. We all have that. Okay. This is what I want to do. I'm going to stop talking here, or I'm going to try to stop talking. I like talking, of course, but I'm going to stop talking and give you an opportunity to talk to my listeners about the progress you made from that very first moment that you decided that maybe you could dive off the backboard. Go ahead and take 2 or 3 or 4 or however many minutes you want to use your own freestyle thinking to describe for us how that whole thing went, from thinking that you might dive all the way to getting to the point where you could dive. That whole progression. Can you describe that for us?
So at first, I was really scared. One of my fears was drowning. That was a little fear I've had for a little when I first started to move up and I first started diving. But as weeks passed on, I started to get a little more confident and tried a little. And then I finally got it on my own. She was like, all right, I'm going to help you. And I'm like, I don't need help. And I just kind of did it. I kind of felt amazed with myself. A little surprised, actually.
You surprised yourself?
Yeah.
Because you were able to do it, or what?
I surprised myself because at first I really didn't believe in myself.
Mm-hmm.
And one thing I want to say to the listeners is you just got to believe in yourself sometimes.
Mm-hmm.
Sometimes you just got to let go and just believe.
Mm. So I believe my listeners just got a taste of the magic of Isabella Levesque, and I just want to say that. But I want to ask you, Isabella, speak to that just a touch more, this idea of sometimes you just got to believe in yourself.
I have some friends that dance, and they're like, no, I can't do like a back handspring. And I'm like, just believe in yourself. And she's like, no, I can't. And so I took her out of the class. She told her teacher she had to get something. So I took her out of the class and talked to her. It was like a pep talk.
Mm-hmm. Yeah, like a coach.
Yeah, and I just kind of felt like a grown-up, kind of just talking to her, and she's younger than me. I told her, like, just do it. You'll be fine. I'll be here the whole time watching. You're fine. Just let go and believe.
Mm-hmm.
And she went out and did it.
She did a backflip. She did a back handstand.
Mm-hmm.
Unbelievable. And now she's someone who can say, I do back handstands.
Back handspring.
What's that?
Back handspring.
Back handspring. So sorry. Yes. But now she's someone who can say that she does back handsprings.
Yeah.
And it's a function of you being a mirror for her and letting her know that she'll be fine, that you've got her back, that she's supported, that if she believes in herself, it's an opportunity to actually get something done that she doesn't think she can do. And then you were there to witness her doing that.
Yeah.
Outstanding. It's really just terrific, amazing. So not only are you very well achieved on your own, but you also have this remarkable skill to be the source of other people achieving great things. Do you know that? Do you get that?
Yeah, I do.
Yeah. Yeah, that's a skill, and that's an accountability. That's something that, as someone who's almost 11, you have to be responsible for, or you get to be responsible for the rest of your life, that you are a source of other people growing in ways that they didn't know they could grow. You are that.
I'm kind of speechless. You kind of just blew my mind.
Yeah, I get it that I'm blowing your mind, but one of the things I'm blowing your mind with is by just being a mirror for who you really already are. Do you get that? Again, I didn't make anything up here. This is just me reminding you of the power you are as indeed one of the most amazing, if not the most amazing human I've ever met. So you are that person, and you're able to carry that out with immense and total grace. That's sure the image that we get out here when being with you. So thank you for being you, is what I have to say there.
Thank
you. Could
you.
say you're welcome. You could say you're welcome. Yeah, that's good.
You're welcome.
All right. Well done. Well done. Okay. So let's go off to the next thing, because I think there's some more. So we've talked now about dancing. We've talked now about swimming and diving.
We kind of talked about gymnastics.
What's that?
Acrobatics was kind of like gymnastics, so.
Acrobatics is like gymnastics. Okay.
So I'd kind of cross that off too.
Okay. Now I'm going to ask you about something that I think my listeners probably also have a little taste of, a little morsel of a taste of, and that is how much you like to have fun. Just straight fun. Like you're like one of the funniest people I've ever met, and you just know how to have fun. You know how to have fun with your animals. You know how to have fun. You know, your dad lets me know sometimes about some fun you have with him. Is having fun an important part of your life?
Yeah. If I didn't have fun, I wouldn't feel like me.
Yeah. If you didn't have fun, you wouldn't feel like you?
Yeah.
That's pretty great. I love that.
Because of who I am, I'm the person that's happy and loves to do stuff. That's who I am, and I'm never going to change that.
That's right. You really aren't. It's at your core. You're happy. Say that again, Isabella, for my listeners. That's amazing.
I'm always happy, and that is who I am, and I will never change that.
That's
ever.
You know what? I know.
Ever.
Yeah, ever.
I could say ever for 20 minutes.
Yeah, not even for 20 minutes. I totally get that. Like never, ever.
Yeah.
Wow. Okay, what we have here is an extremely articulate, someone who knows the language very well, who can describe her actions, who can giggle and have fun at the same time, be brilliant in how she describes her dancing or her swimming or her fears or her conquests of her fears. Some very, very wise conversation coming out of your mouth, Miss Almost 11. And what we're doing here is showcasing a little bit about who you are now. Isabel, you have a kind of a different past than most kids in the United States. You have a different past than most children of parents. What's brought you to be the magic that you are is uniquely you. You have something, your life is, up until this point, has not been sort of an average ride to almost 11 years old. You have a extremely unique pathway in having become not only Isabella, but then Isabella Levesque, like not born Isabella Levesque, but definitely Isabella Levesque now. And I'd like you to point a little bit to what your history is, how you know your history to be in the last, 11 years, almost 11 years. Can you give us a little synopsis of what growing up being Isabella looked like?
I think Dr. Fred knows I am adopted from Medellin, Colombia. I was in an orphanage for 6 months until, as you guys know, Ryan and Melissa, my mom and dad, adopted me. And originally my name was just Manuela. But when my mom and dad came, they named me Isabella. And now I am Isabella Manuela Levesque. And as I got older, they told me more about what my past was like.
Now, did they go down to Colombia and get you?
Yes.
Okay, keep going.
Yeah, they went all the way to Colombia and got me. And when I came home to my family, I didn't cry at all. I just kind of looked at everybody with big, bright eyes, like, here I am. I'm Isabella.
Mm-hmm.
And as I got older, my mom and dad told me that I was adopted. They started that when I was, maybe 1, 2 years old. So they started out young, that I was adopted. And then as I got older, they kept reminding me, you're adopted, you're adopted. I'm like, yes, yes, yes. And as I've gotten older, I've started to get I've missed my mom and dad, my real mom and dad.
Mm-hmm.
A little.
Mm-hmm. Makes sense.
Sometimes I think it was 2 years ago, I completely broke down in tears because I miss them so much. I am learning Spanish because my dream when I'm older is to go to Colombia.
Mm-hmm. So are those two things related, this idea of missing your parents and then of going back to Colombia?
Kind of, yeah.
Mm-hmm. And you miss your parents and then you're learning the language so that someday
I can maybe just go there and sightsee and see the adoption center that I was at.
Mm-hmm. Yeah. Now, do you know anything about your family now? Or the rules, or how is it? Are you able to keep in touch?
You mean my parents?
Yes, sorry.
No, there's no way we can keep in touch.
Mm-hmm.
The woman that was there at the orphanage and took care of me somewhat, they had no information on my parents. So we sadly don't know anything about them.
Mm-hmm. Yeah.
And the other thing is, I don't even know if I even had a dad or anything.
Well, you have a dad, but you're not sure about him.
Yeah, and I don't even know if, you know what I mean.
Yes. You don't know. Yeah, I got it. You have no idea of the circumstances of who your dad was or where he is or what kind of guy he is or even his name.
Yeah. They don't have... The only information that they have is my date of birth.
And what is your date of birth, by the way?
May 28th, 2009.
May 28th, 2009. So I get that that's how it adds up to being nearly 11.
Yeah.
That makes sense. So they have your date of birth, but they don't have even any documentation about your birth. They don't have a birth certificate per se then.
There's something I have here.
You have a piece of paper about something about you, yes?
Yeah, it could have just been the thing when we went to the judge and stuff like that. Oh, it could have been a copy of my birth certificate. A copy
of your birth certificate. That could be it.
Yeah, in English, obviously.
So I'm going to ask you a question that's this time is kind of geared towards people who are over 11 years old. So if you were older than 11, I know you'd be able to answer, but you're just like a little bit less than 11. So I'm hoping that you can take that leap into being at least pretending that you're at least 11. Okay. So the question is, when you think about your history and you think about who you've been and missing your parents and what's going on in Colombia and the present day, and you'll always be happy and you're a dancer and you're a swimmer and you're nothing but fun ever. There won't be a time where you're not that ever, not even for 20 minutes. And your name has been changed and who you are for the world is a source for believing in ourselves. Who you are for the world is just being someone who can help others, really, just by being you, believe in ourselves and then do things we didn't even think we can do. You're a primary example of that, right?
Yeah.
Yeah. Okay, good. And I didn't make anything up. All of that has already been said in this conversation. You made that very clear. So what's the future look like? What does the future look like for Isabella Levesque? When you look ahead all the way to, I don't know, when you're 13 or when you're even 18 or when you're 25, those three ages, for instance, 13, 18, 25, and who knows, maybe we'll put the next one like even 50 years old. What does that look like? What does it look like for Isabella? What's the future hold for you? What do you see? Let's say you just have the best life ever and you get to do and be whoever you want to. What do you see unfolding for yourself?
I was going to be a doctor, but I changed that to nurse practitioner.
From doctor to nurse practitioner?
Yes.
All right.
Or a veterinarian.
All right. I hope I had nothing to do with turning you away from being a physician.
No.
Okay,
You
good.
can.
Okay.
I'm just a little interested in nurse practitioners a little more.
Mm-hmm. So what happened to switch you from doctor to nurse practitioner? What is it about nurse practitioner that makes it a more interesting pathway?
Well, I have a course for school that I use because I'm homeschooled. I've been homeschooled since preschool.
Oh, you've been homeschooled all the time. This is not anything new having to do with our bias restrictions.
Yes,
just
this
the way it
is. Yeah.
Okay. Mm-hmm.
And one of my courses is health. And my teacher is a nurse practitioner. And I've also been to the hospital and doctors a lot. And I've seen a lot of them. And I kind of admire their work that they do.
Mm-hmm.
Like some of them giving medicine to people, shots and stuff like that.
Yes. You have your own little doll set and stuff like that for which you can be a doctor every so often. I remember your dad telling me, right?
He told you?
He did. He's that kind of guy. Sometimes we share delicate issues together, and that was one of them that he decided was okay for me to hear. So as a nurse practitioner, what do you see your future as? Like, what would that be? Where would you be that? And what kind of people might you help?
Well, I want to be a nurse practitioner for children.
For children. Makes sense.
Yeah, because I love little kids.
How little do you have to be called a little kid these days?
Actually, my mom says, like, even when you're like 20 or something like that, you're still going to be my little girl. Like
right. Your mom makes it clear that you can't grow out of being her little girl. That's a totally different question. It has everything to do with your mom and everything to do with moms in general. And it's not quite this question that I'm having here.
Yeah, I just wanted to put that out there.
Thanks for getting that out there, because I could totally see that Melissa's going to put a stake in the ground there and make sure that you never forget that you're her little girl. I think that's what she's trying to say there.
Yeah.
Yeah. Kudos to your mom on that one. Thanks. It's pretty smart of her to put the stake in the ground this early and make it very clear that you never forget that you're mom's little girl. I mean, that's after all, really. You could be 60 and you'll still be mom's little girl.
Mom's little girl.
That's right. Okay, I get that. But now I'm asking you, when you say you're interested in helping little kids, you're probably not talking about that same group. How old is a little kid?
Maybe stop around like 6.
Yeah, around 6.
Yeah, around 6, 7 years old.
At about 7 or 8, you start not being a little kid anymore. Am I right?
Yeah, you start to get more mature.
Yeah, 8 years old, you start to be a little more mature and maybe no longer one of these little kids.
Yeah.
And you're talking about maybe being there for the ones who aren't yet 8.
Yes.
Okay, that makes great sense.
I love to also help special needs.
Special needs kids too. So
yes.
Now tell me more about your relationship with special needs people.
They are just, especially Down syndrome kids, they are adorable and they're so cute and just, it's like they never have a dark side. Mm-hmm. They always have a happy, positive side. They're just really happy.
That is a fascinating observation. I love that. I'm totally swimming in that one right now. So you're saying that, did I get you right? It kind of spun by me that you're talking mostly about Down's kids in this case, but others that are special needs, yes?
Yes, autism is great too. And I love helping kids in wheelchairs and stuff like that. Mm-hmm.
So in some ways, these special needs kids, part of having special needs is that you don't have a dark side. You don't have the luxury to be just whipping around your dark side left and right.
Pretty much, yeah. It's kind of like they're all, when they talk, they're in a happy mood. Like, hi, how are you? Kind of like, it's really cute.
Very cute and inspiring.
And yeah, very inspiring for people to just just be yourself and just be happy.
It seems like we have a little theme going here with this idea of just be yourself and be happy.
Yes.
If you had like a recommendation for my listeners, there's some listeners out here who are having great lives. There's listeners out here who have beautiful children. There's listeners out here who are beautiful children for their parents or for their family, for the world around them. There are some people who are just having beautiful lives as they listen to us today. And there's other people who, at least for now, are thinking that their life isn't so beautiful,
that it's too hard or difficult or too much challenge or terrible or frightening or all the many pains and misery that some people, as you know, right? People experience those things too. Do you have something that you could tell my listeners? What does it take to live day to day like Isabella Levesque seems to have mastered? What does it take to live day to day?
It takes a lot of positivity.
Mm-hmm.
Is that a word? Yeah.
Yeah, great word.
A lot of positivity, and just a lot of happiness.
This is an area where I think you really do excel, and maybe you don't know it as such, but it isn't that you don't accept misery. In some ways, you're very familiar with misery.
Yes.
It's just that you don't have it run your show. But it's out there, right? You get it. You respect it. It's real. You get that people are frightened or in pain.
Yeah, misery is real. Depression is real and stuff like that.
Yeah. Like people are
misery,
depressed.
Depression, anxiety.
Anxiety. Mm-hmm. What else? Name some others.
Anxiety.
Confusion.
Mm-hmm.
Hopelessness.
Not believing.
Yeah, so lack of faith. Feeling stuck.
Yeah, kind of like in a pickle jar. Like, I'm in a pickle.
I'm in a pickle. Or unable to get things done that they say they want to do.
Yeah.
Overwhelmed.
Sometimes upset, frustrated.
Upset or frustrated. Maybe trouble sleeping or trouble finding purpose.
Yeah.
Like, why am I here after all? What's the point?
Yeah.
Mm-hmm. And then some people can be irritable or mean even, yes?
Yes.
What's the story with mean people? Have you got any ideas or answers for people who are, what should we do with people who are in our world who maybe are just really easy to irritate, or maybe they're not necessarily kind? What do you do with those people?
I know some friends that used to bully me at a camp. And I would get bullied because people think that, oh, you're too small, you can't do this. Or like, oh, your head's too big for your body, or like your ears are too big, or stuff like that. And when they're doing it to a friend, I just tell them, stop. I don't care what you think about other people, just stop. You can think about other people in the way that you want, but you don't have to say it.
And that worked for you in many cases.
Yes. And this is for any of the listeners that ever do bully. You need to stop.
Oh my God. Mm-hmm.
It gets frustrating to people. And if you don't stop, that's not going to make the world a better place.
Yeah, so there are some people out there, by the way, who do bully others, and they can be of all ages, right? I mean, there's people out there who know that they're mean to other people.
Mm-hmm.
And you're saying
teenagers,
stop.
Kids, grown-ups.
Even grown-ups, yep. And your word for them is just stop.
Yeah.
What should they do instead? I mean, they got a habit. Isabella. They like being mean to people. What are they supposed to do with that time if they decide not to do that anymore?
You can think mean and think all these mean things to people, but just keep it to yourself.
I see. So we're looking at the breaking point here is when something comes out of your mouth about it. That's when the damage comes.
Yes.
You can think whatever you want, but once you start saying it to somebody, that's crossing an important line.
Mm-hmm.
I see. So what should they do? They look across the room, they see somebody who's goofy or less than or has too big of a head, or they don't like what color they are, or they don't like how bad or how good they do in school, or they think their family is poor, or they think that maybe they've got a limp, or they've got a funny looking lip or something like this. Okay. And then they see that person, and their whole life they've been sort of making fun of that person and judging that person. What should they do today that's different? I mean, what do you have to say to them right now? What should they do different?
Maybe just stay away from people that you think are weird and funny.
That's interesting. So at least one way to manage this is don't put yourself in that position.
Yeah.
Okay, but let's say I'm in the line at the store, and of course, keeping social distancing rules in effect. And I look over there, and there's someone there. I just think, man, I just want to be mean to her. She's gross, or she's ugly, or she's poor, or she's less than me. And I could get off on being mean to her. What should I do differently? Why shouldn't I be mean if I want to be?
It hurts people's feelings. It gets passed on.
Say more about that. The second one.
It like gets passed on to family. Like, oh, this person bullied me, and then the family passes it on to people, and then it passes on and on and on and on.
Mm-hmm.
And another thing, oh, that'd be fun. Yeah, maybe I'll bully too. Like, maybe I'll join their dark side.
They join their dark side.
Yeah.
All right, Isabella. Well, I totally get that. And I guarantee my listeners are showing this particular audio to their children or to their friends or maybe to their husband or wife, having heard your words of exquisite, remarkable wisdom. Thank you. So I'm now going to go to another place. I got you just exasperated a little bit here, a little exhale, but here we come at you again, Isabella. On a couple of occasions this conversation, you brought up a certain concept that us adults think we're pretty aware of. And that is something that you particularly called our dark side, the dark side.
Yeah.
You know, you mentioned that the special needs children, for instance, they don't live inside their dark side.
Yeah, sometimes they reveal it at home, but normally they don't reveal it in public.
They don't reveal in public. And it sounds like you're very inspired by that. You think that that's very attractive for you to be working with them or to be friends with them or to, be a source for them. Is part of it is that they have their dark side in such a place that they don't have to reveal it in public.
Yeah.
Right? Yeah?
Right. Yeah.
Okay. I am curious about this dark side. So do you think every human has a dark side?
Yes, I do. Most people they don't think they have a dark side. They're like, oh, do you have a dark side? I'm like, no, absolutely. And then someday you just show it.
That's part of being a dark side, is that it shows up when you don't even know you're showing it. That's part of its nature, isn't it? So even special needs and even people who are really old and wise, and even you have a dark side.
I do.
And you do. Like, you make it very clear that you definitely have a dark side.
You don't want to see me on April Fool's.
I don't want to see you on April Fool's.
I really got a dark side there.
On April Fool's Day, you let it all show up.
Yes.
Oh, that's like the sound of a dark side woman right there. So you pick a day. In this case, it's April 1st.
Mm-hmm.
For like letting your dark side out of the cage. Yeah?
Kind of, yeah.
And it would be a day that you're thinking, I don't need to, probably if I want to keep my life clean, well, maybe I should not hang around with you on April 1st, right? You're kind of like dark on April 1st, yes?
Yeah.
April 1st just came and went. April 1st was 5 days ago. It's April 5th now.
Yeah.
So 5 days ago, did you show your dark side a little bit?
A little.
Are you care to reveal what you did for my listeners? It's okay if yes or no. For instance, just a quick example of a little bit of Isabella Levesque's dark side. You don't have to do the whole thing, but just a quick example. What did you do on April 1st that you wouldn't have done any other day?
Well, it was a prank on my dad.
A prank on your dad. We're ready for this. Bring it hard. Bring this baby hard.
You know my dad's listening to this, right?
I know. Your dad is actually not only listening to this, he's putting it all together when we're done. He's going to spend hours with this thing to make sure it's perfect. So go ahead and bang this one out. It's really great. So you had a prank on your dad on April 1st.
So me and my mom had this idea because he loves to drink tea.
I know that. I've had tea with him before. That's great.
Yeah, and we were going to pretend we smashed his pot.
Oh.
That he boils the water in. So we were going to find a fake video or like a sound of a crash, like that sound like it smashing on the floor. And Mom's like, no! And I'm like distracting him. But when Mom went into the video, she forgot to pause it. So it went too early and we had to do it at the right time. Next thing I know, he hears it. I'm like, did you hear something? He's like, yeah, I heard a crashing sound. And I'm like, Mom!
Oh, my goodness. So you were trying to choreograph things without rehearsal, and she let it on a little bit too early, and the whole prank sort of got broken down.
Yeah.
So your dad didn't even get the prank done on him.
No, he didn't.
Well, it was a good try. It would have totally freaked him out, I'm sure. So
Yeah.
the luck of angels, he was protected in this one. He did. Yeah. Was there other things that happened on April 1st? Any other pranks or any other places where you showed your dark side? Maybe with your rabbits or with your...
No, we only did a couple pranks. The other's not as great as that one, but there's one of them. Maybe I'll share it to you sometime, but I don't know if I want to share it on this.
Okay, so maybe not on the public. You could do it, and maybe you'll tell me off the air sometime.
Yeah, my dad did try to pretend that something popped up on my iPad, and he said, Donald Trump has coronavirus.
Oh.
But his voice is like, Donald Trump has coronavirus.
Oh.
It was like squeaky, like, yeah, we don't believe you.
I got it. Trying to find times to laugh and joke about coronavirus. It's not so simple, but it is. There's a place for it. There's a place for it, even to be humorous and joking even about that virus every so often, right? We got to let off our steam somewhere.
Yeah.
Yeah, beautiful. All right. Well, Isabella, I could keep talking to you, and I look forward to our next conversation. And I don't know if you know it, but you've now been invited to my Seder on Wednesday, my Passover Seder on Wednesday night, which is April 8th. So 3 nights from now, we'll be together again. It's going to be a really, really beautiful time. It's Passover season. And between Passover and Good Friday and Easter all this week, we have a whole lot of before we get off, I'm going to have you talk a little bit. Is faith and God and spirituality, are they part of your life too, Isabella?
Yes, I do have a good connection with God.
Please say more.
Sometimes when stuff is hard, sometimes I just pray to God.
Mm-hmm.
Like, Lord, please help me clean this room. Or I could be in a hard time. And I just go on my knees and just start to pray.
Mm-hmm. And you have a working relationship with this God of yours.
Yeah.
That's fabulous. Of course you do, right? I mean,
Yeah.
if you're going to do magic things, you better have a relationship with God.
God, yeah.
I got that. That's awesome. Isabella, say your whole name out loud, like the way it is now, with your middle name and the whole thing. Can you say it with the accent and exactly how you want to be known as your name? It's really important that you say your name because that's the name you really are. So tell my listeners what your name is. Your full name, please.
My full name is Isabella Manuela Levesque.
Absolutely awesome. Beautiful. Thank you.
Well, thank you for having me, Dr. Fred.
It's been a deep and honest, total fun. It's been a blast, a complete pleasure, a complete honor. I humbly appreciate your willingness and our relationship. Your willingness to come on to the show, our relationship from the very beginning, truly a sourceful relationship for how and why to be happy, even when I can't figure it out. Sometimes I think of you, and that's what brings a smile to my face. So I just want to know that that's really who you are, even when you're not immediately in my picture. It's really who you've been from the moment I met you, and from the moment that I met you, really.
Thank you.
So my Welcome to Humanity listeners, it's been a deep pleasure to share my love for Isabella and Isabella's love for the world with you. And I hope that this one leaves you inspired and moved as much as it did for me. It's great to be with you this afternoon. Again, it's a gorgeous day here in Los Angeles. My hope is that it's gorgeous where you are as you're listening now. And even if it's not, it really, really will be soon, or it really has been, or there's a space for you to find the honor that comes with welcoming your humanity. So Isabella, thanks for joining us again. It's just been super cool to be with you. Thanks for being on the call.
Bye.
Bye-bye. Thank you so much for tuning in today. Something I just really, really love about Isabella, she just comes from the hip and she's just so sweet and worldly. I mean, isn't it true? She's like from another planet or has multiple lives, and she's wise so far beyond her years. And she's just a pleasure to talk to be around, to be a friend of, and to even look at and listen to. Just a wonderful girl.
So maybe as you were listening, you thought of a person or maybe a few people who need to hear this episode. So reach out to them right now and invite them to listen and to subscribe to the Welcome to Humanity podcast. Speaking of subscribing, I'm going to ask you to put forth a little effort that something will have a big impact. First, could you please take a moment to hit the subscribe button right there on your podcast player? You're going to get the latest episodes as they become available if you do. And second, if you actually appreciate what we're doing here, could you just take 5 minutes to leave a review on Apple Podcasts? Subscribes and reviews are 2 major ways we can reach more listeners with the Welcome to Humanity podcast. And if the conversations we're having here contribute to your life, just please pay it forward by subscribing and leaving an excellent review. I'd be truly grateful for your support, and so would my listeners. Also, to catch up on any past episodes you may have missed, head on over to welcometohumanity.net/podcast. So until next time, this is Dr. Fred, and this has been another Welcome to Humanity podcast. Thank you so much for listening. Enjoy. Take care.